We are live.
All right. Welcome everybody to the meeting of the Oregon Early Learning Council on April 28th, 2021. We're very excited to have this meeting kicking off with lots of exciting changes happening, and I'm going to define them as exciting. So we'll assume everything is going to be moving forward in great shape. And Remy, let's start by having you call the roll, if you would.
Of course. Angie Blackwell.
Here.
Katie Brooks, we know she is on her way right now, so we will move on to Peter Buckley.
Here.
And Kubish.
Here.
George Mendoza.
Here.
Dr. Peg Miller.
Here.
Kali Thorne-Ladd. Kali? I know you're here.
I'm here. Sorry.
Kali.
Welcome, Kali. And then we have Sue Miller, chair.
Here.
And then today we have Kate Wilcox standing in for Pat Allen, the director of Oregon Health Authority.
Here.
Colt Gill, the director of Oregon Department of Education.
I'm here, thanks.
Thank you. We have Chelsea Bunch, who is standing in for Margaret Salazar, the director of Oregon Housing and Community Services.
Oh, I'm here. Hi, Kali.
We have Liesl Wendt, and we know that she is currently on her way, so she will be joining us in just a second. And finally, we have Maryam Calderon, Early Learning System Director of Oregon Early Learning Division.
All right, great. So welcome everybody, and thanks for being here. As the council members know, we begin each of our meetings with an essential understanding of Native Americans in Oregon. And we're very fortunate that one of our council members is Angie Blackwell, who is a tribal member of the Confederated Tribes of the Grand Ronde. So Angie, I will turn it over to you.
Thank you, Sue. As Sue mentioned, I'm with the Confederated Tribes of Grand Ronde, and my people are the Umpqua and Rogue River, who are actually from the Southern Oregon area, and they were moved to the reservation in Grand Ronde in the 1850s. So been here ever since. I've spent most of my life in Grand Ronde, and most of my adult life working for Grand Ronde in some capacity or another. I only have a couple of comments to share about Lifeways today, particularly that Lifeways are very tied to place, and therefore they vary significantly from tribe to tribe. The geography, the plant life, the animal life, the seasons would dictate for tribes when, how, what to collect and hunt for food and for other things like materials for weaving or materials for carving into tools. So you might see that depicted as a seasonal round, which is a calendar of sorts, but it's round. And it basically shows all those different life forms and throughout the seasons where tribes might have moved within their lands or within the region where they knew crops were prime for picking or for hunting. So even though not necessarily nomadic, camps would be set up in these different regions for that part of the season for collecting. And I wanted to share that even it may be very obvious, but these lifeways were lessons taught to us from the land. We learned how to live on the land from the land, what was available at the time and what we can make use of. And that's why they're going to differ from tribe to tribe. I encourage you to learn more about the tribes in your area specifically by going to their website. Usually they have a page under cultural resources or maybe their museum perhaps, where you can learn a little bit more about the tribe specific to your area. And I think that is everything that I want to share about Lifeways today. Thank you for your attention.
Sue, you're on mute still.
Thank you, Angie. You always do such a great job of sharing your culture and your background and encouraging us to really learn more about the tribes that are in Oregon, but certainly in our own regions in Oregon. So we appreciate you grounding us for our meeting today. So
Happy
thank you,
to be a
Angie.
resource. Thank you.
You are a great resource. And as I think everybody on this call knows, there's probably going to be a tribal hub formed, assuming the legislation is moving through. And I'm guessing Angie will be a great resource as that hub gets established. So we're lucky to have you, Angie. Thank you. So at the beginning of our meeting, we decided that we wanted to acknowledge Maryam, if we can get through this, holding it together, and also welcome Alyssa. And then at the end of our council members, we'll have time, we've saved time so that we can have more of a conversation with Maryam. So this isn't the only time to have a chance to chat with Maryam or to make any comments. But we wanted to open the meeting by acknowledging what an incredible leader Maryam has been for 3.75 years. She obviously has brought early learning to the forefront in Oregon, has certainly been the fearless leader for the council and for me personally. I've learned a ton from Maryam. Of course, I have a ton more to learn, but we'll have to do it a little long distance in the future. So we have benefited as a council. Obviously, the state has benefited, and we have a wonderfully strong early learning division that is going to be able to carry on and carry forward what Maryam has started and what Alyssa is, I'm sure, going to build on. So Maryam, we want to thank you very, very much for the foundation you have given us. And council, we had a plaque that was supposed to be delivered to Maryam before 1 o'clock today. Last I heard, it hasn't arrived. No, of course not. The best laid plans. This whole virtual living is not all it's cracked up to be. So I think, Remy, I may need you to read for us what is on the plaque, since Maryam can't read it either.
Well, and Calvin and Lola will let me know, my dogs, when it arrives. I'm sure it arrives during the council meeting, and I will make sure I grab it and show it. Thank you.
So Remy, will you just read for us what is on this plaque? And
yes, I'm sorry, I'm pulling it up right now. It says, presented to Maryam Calderon, Early Learning Systems Director, by Governor Kate Brown and the Oregon Early Learning Council, with appreciation for your leadership as you fostered your vision for Oregon's early learning system and expanding early learning services to Oregon's children and families. You are an inspiration.
And that inscription is going to be on a wooden plaque in the shape of Oregon. So you can put it on your wall in Washington, D.C., and everyone will walk in and say, oh my gosh, you must have lived in Oregon. So we're sorry it's not there yet for you to, have it, but it'll be there soon, Maryam.
Thank you. That sounds perfect. Amazing. Thank you so much.
And Alyssa, I don't know if you can jump on video. There you are. Hello, Alyssa Chatterjee. Are we fortunate to get you back again? Those of us who've been on the council for, well, at least the last 4 years, 3 or 4 years, know that Alyssa used to be at the Early Learning Division before it was actually a division. So she really is a historian for us. And then when she took the position as a policy advisor to the governor, I wasn't sure how the council was going to survive without her, but obviously we did with Maryam, Remy, and David, and many others. But it is great to have you back at the division, Alyssa, and we're so fortunate to have you coming into a leadership position again.
Thank you, Sue. I'm very excited to be coming back and be able to work more closely with you all again. I have not been far. Maryam and I talk very regularly, but I am excited to be able to come back and work with you all again. Just deep appreciation for the grace as this transition occurs, and of course, deep appreciation to Maryam for getting us this incredible vision and keeping us moving down this path as we work towards what we want to see for our youngest and most vulnerable kiddos in the state.
Yep. Yes, we are very fortunate, and I think we all know that for the past and for the future. And I don't know, Colt, and for the agency directors and representatives, because I don't think you're going to be on at the end of our meeting, if you'd like to make any comments to Maryam and Alyssa, this would be a great time to do that.
You bet. I think we get other opportunities as well, but really happy to do this with the council here. So I would just say that I have had the privilege to be involved in early learning for a long time in Oregon. As a school district superintendent, opened preschools in 3 districts and worked closely with our partners at the early intervention and early childhood special education over those years, and was involved in the formation of the early learning hub in Lane County. All this before I ever came to the state and got involved. And all of that work was super exciting and challenging at times. But what I would say in just these last few years that Maryam has been here, she has kind of set an entirely new and really ambitious trajectory for early learning in Oregon. And Maryam, you may be leaving, but the policies that you helped us create and put into place in Oregon will last here for a long, long time. And just much, much appreciation for all you've done for our youngest children and families here in the state of Oregon. So just, I don't know, there's really not enough to say about the impact of all the policy that you have brought forward in the state. And Alyssa, oh, sorry. Thanks, Mary. Alyssa, I just look forward to working in a different way. So I worked with you actually, again, before my time at the state in connecting with the Early Learning Council and getting our hub set up and through communications in that way. And back when you were with the division, and then worked, I think, much more closely over the last few years as you've been in this role with the governor's office. And so really look forward to seeing where you're going to take the division and possibly the agency as it moves forward in the next couple of years. There's a lot of really significant work to do to really prioritize Oregon's youngest, again, children and families. And I think you're the right person to do it. So I'm excited to work with you.
Awesome. Thank you, Colt. Great sort of historical perspective on these relationships. So
my age showing.
Well, you're not alone in that one. Anyone else from one of the agencies? Kate?
Well, I have to say my connection and friendship and relationship with Maryam started on a bus in DC. I think it was DC, wasn't it? When we were there for was it a build meeting? Mm-hmm. And she, having been in Oregon, said, I seek out people from Oregon. And she found me and she sat down, we had this wonderful conversation. And then to see her show up in Oregon a year or two later was just delightful. And so it's just been such a pleasure to work with you. I just want to echo everything that Colt said and just add, what you also bring to this is so much heart along with your head and so much appreciation for your lived experience and bringing that voice to the forefront and elevate it to the highest levels for everyone who needs their voice heard. So Maryam, personally, I'm going to really miss you, and professionally, I'm really going to miss you. And thank you for everything that you anchored here and are going to be able to, it will outlive you. Hopefully it outlives all of us, this great vision, right? And Alyssa, you were here from the get-go. I remember those days way, way back when the division was created. And so it's really, that not enough can be said about people that start in from the ground up, and because they know every piece of the work. And so that I feel like really gives a leader great appreciation and understanding, and just adds more depth to the ability to lead the work. And so I'm really thrilled that you're going to be following as Maryam's successor, and welcome back.
Thank you, Kate.
I'm totally gotta go behind Kate.
All right, Chelsea.
I mean, I certainly know that I would imagine that I would totally speak on behalf of Margaret, but I also would speak for myself that it's been really incredible working with you, Maryam. I haven't been at the agency, I guess, for all that long. I almost feel like maybe we started at our agencies very close, similar time, but I've just been really, got invigorated very early on when I started around just the connection between housing and early childhood education and the importance of really truly investing in our young children. And have seen you be solid in that mission and in that vision, to articulate it clearly and boldly, to set foundation with policy and practice. And so I would absolutely agree with Kate that you have laid such a wonderful foundation. I am incredibly sad that Oregon is losing you, and because it's important to always hold the both and, I'm really thrilled that you're going to do bold visionary work at the federal level that will have no doubt will have impact here in Oregon. So I'm super excited for you. We're going to miss you, and we send you off with all the love and support in the world, and just so much appreciation for you and your work, and totally agree with like the soul and the heart is just as important as the mind, right, that you bring. And so just thankful for the way that you show up. And Alyssa, man, I'm pumped. I mean, like, what a brilliant transition, right? Like, just brilliant transition. Alyssa and I had a chance to work together early on. We were able to get pulled into the Raise Up Oregon team, which has been one of my all-time favorite cross-agency teams that actually feels like it's doing work, talking about silo busting. And so I'm thrilled to have you back in this position, and I'm thrilled that we get to work together in new ways, and have no doubt that you're going to take the torch and continue to lay even more foundation. And just really excited and have missed seeing all of you, missed seeing you both. Thank you.
Thank you, Chelsea. And we appreciate Ruiak. Just let me say that before we move on. And I'll just read what Liesl has put into the chat box in case she is there she is herself. Hi, Liesl. You are muted, I think.
I was just saying the Amazon truck was coming and the dog was going nuts. So I decided to type something in the chat. So I apologize. Actually, Mary, you probably don't know this, but Swati, we're mutual friends with Swati. And one day when I was commiserating about something when I was at Multnomah County, she's like, you got to meet Maryam. You two need to work together. Just bringing that system focus and that commitment to, not just talking about things, but really rolling up the sleeves and making things happen. And she was right. And I'm disappointed to see you go, but we'll stay in touch and look forward to what you'll be able to do from the DC perch, and look forward to working with Alyssa in your new role, and agree it's a smooth transition, and looking forward to what will happen next.
Awesome. Thank you, Lisa. So council members, as I say, the rest of us will have a chance at the end of the meeting to say comments or chat with Maryam. So we will move on at this point and this is where we invite public testimony. And we just have one guest whom we all know very well who has asked to make some comments. And actually, I asked Mary Louise to make some comments. So Mary Louise McClintock, we'd love to hear from you.
Thank you, and it's great to see you all. I'm both happy and sad to be here for the send-off to Maryam, and I just want to quickly, before saying what I came here to say, just echo and underscore everything that has been said about both Maryam and Alyssa. Being a thought and funding partner with Maryam has been a really important part of my job in the foundation sector over the last 4 years. But I also look forward to working with Maryam in her new role and with Alyssa. And in fact, to segue, what I'm here to tell you about is a piece of Maryam's legacy, because we are announcing today, just this morning, Oregon Community Foundation is making available $1.2 million in grants to support summer parent-child learning programs. And that is part of the $250 million package that the legislature decided in cooperation with the governor to allocate a couple of weeks ago. And most of those funds, as you know, will be distributed by the Department of Education and the Early Learning Division. But OCF was asked to take on distribution of 41.2 million of that amount, with 40 million being for kindergarten through grade 12 summer learning programs and 1.2 million to support birth to 5 programs. I think Remy has just put in the chat box the link to our website where you can find more information about the grant, the Birth to 5 grant program. We're calling it the Early Childhood Summer Support Grant Program. And the deadline will be, we'd really appreciate your help in distributing the information so we can get it far and wide. We do want to reach all communities and all corners of the state. We've been working with Maryam and her team to develop that program, and in partnership with the Early Learning Division, we decided that these grant funds will be available for application from organizations that are not eligible for the Early Learning Division's summer learning funds. And so those would be organizations providing Oregon Pre-Kindergarten, Preschool Promise, and the Early Childhood Equity Fund grantees. And the OCF grant funds will be available for parent-child group-based programs, because a big piece of the goal is for parents of young children to be in community, build and strengthen community, and also support their children in learning and recovery from the effects of the pandemic. And our focus will be on reaching children who have been disproportionately impacted by the pandemic. I'm happy to take questions if we have time for that, Sue, or contact me afterwards.
Okay, I think we'd better have people contact you afterwards, Mary Louise, or go on the OCF website. But great news. And once again, OCF is such a great partner with the state. We're very, very fortunate to have you, as well as the rest of the philanthropic communities, as our partners in this important work. So,
well, and we're very honored to be asked to partner with the state in this way. We appreciate the confidence.
Yeah, that'll be exciting. Okay, so I don't think there's any other public testimony, correct, Remy? I'm assuming that's correct. So we're going to now take some time, as we do at the beginning of each of our council meetings, to invite council members to give us updates on what's going on in your agency, if you're an agency director or representative, what's going on in your region, in your field, sort of whatever you want to update us that will just add to our understanding of sort of the framework and the patterns in Oregon around early learning. And I'll invite our agency director partners to go first, since you may well be called off earlier than the rest of us to go to other meetings. So I'll see. Who would like to start? Colt, do you want to lead off?
Sure, I can start, Sue. And I saw in the chat too that Maryam may have received her gift. So I don't know if that happened, if you want to show it or not.
Oh, we didn't hear the dogs.
Yeah, I was muted, but they definitely barked.
Oh.
I was here, so
UPS arrived.
Can you guys see it?
Yes. Yeah.
Oh, good. It does look like the state.
Beautiful. I
Awesome.
love it. It's the wood and it's beautiful. I will treasure this.
Awesome.
And always keep it with me. Thank you so much.
You're welcome. Thanks, Colt, for noticing that.
Yes. And mine will be short today, and I do have to jump off to another meeting in just a little bit here. Two things that I wanted to share. One of them was that right now, the Department of Education is hard at work doing engagement around the fall guidance for school. So it's a kind of a challenging time to do it, because our fall guidance, as we talked about it a few weeks ago, was very rosy and was looking like, that our restrictions and protocols would be greatly reduced, and we would be moving much more towards recommendations for the fall. We hope that that's still true, but as all of you know, we're currently in a surge in Oregon with the fastest growing rates of COVID-19 of any state in the country at the moment. We do have a strong plan from the governor and from the Oregon Health Authority to curb that, hopefully within the next 2 or 3 weeks. But at the same time, we really need to be getting input on what school needs to look like to support all of our learners next year. So we are meeting with a number of communities through many of our own affinity-based advisory groups, through some outside partners. We met with the 9 tribes and the education cluster earlier this week. We met with private schools earlier this morning to get their input. So we'll be doing this over the next couple of weeks. We will then create what we're calling a discussion draft that will show some of the leanings from the Oregon Health Authority and from the Oregon Department of Education, and go back out for another round of engagement. So I'm happy to connect with Remy for those council members that might be interested in participating in any of that engagement, to kind of review where things are moving and to give us further input on that. Second, I also wanted to share, so I was really glad that Mary Louise was sharing the summer learning efforts. I wanted to let everybody know that those efforts include a number of things. I'm sure Maryam will probably talk about some of those directly from the Early Learning Division. But we do have summer learning grants for school districts to offer credit recovery for high school students that are not currently on track to graduate within 4 years. We have application processes out for summer learning and enrichment and social, emotional, and mental health support in kindergarten through 8th grade. So this is eligible for all school districts and charter schools, with a lot of encouragement for them to partner with their community and community-based organizations to come in and help support that, provide some of the enrichment activities, or even the resiliency building kinds of activities. And then we also have a school childcare grant for children in grades kindergarten through 5th grade. This can be standalone. It's also designed to be in partnership with these other activities. So as a school district receives a grant, these are not competitive. So every school district is eligible. So it's asking them to move forward and submit their application and receive those funds. But if they do that, they could also expand their childcare through partnerships locally with childcare providers, and ensure that those children not only have those activities during the day that are enrichment and learning and resiliency building, but also have childcare earlier before the program start and through the end of the day for families that work. So all of those grants are open and available, and I'll drop that link into the chat.
Great.
And then, as Mary Louise said, all the OCF grants, so the $40 million for community-based organizations and tribes and other partners for enrichment activities can be applied for separately. So those don't have to be attached to these school grants in the link that I just gave you. And the OCF is leading that effort and has released that information today as well. So that's at this website. That includes a link to both the early learning grants that Mary Louise talked about and the K-12 grants that can also be inclusive of families as well. So with that, I'll stop, and thanks for your time today.
Okay, Colt, thank you very much. And yeah, this is a challenging time with things right now going backwards and very discouraging, but hopefully that will turn the corner again. So thanks for your work on that. Liesl, Chelsea, or Kate, would one of you like to give us an update? Chelsea.
I'll go. Really great to see y'all again. I feel like it's been so long since I've seen so many of you. So I'm really glad and happy to be able to step in for Margaret. Kind of three big buckets of things, and you'll see me kind of looking back and forth because I want to make sure that I get to all of the points. So first is kind of on the legislative front. Just a huge thank you to you all as the Early Learning Council, and particularly to Sue for your support of HB 2100. I think you all have heard from Margaret talk about this is really our modernization of our statute that kind of guides how we direct funding to community for housing stabilization services. And we essentially are proposing to kind of, I call it kind of bust it open a little bit and make sure that we can broaden the table of support and really access to our funding. So we just really appreciate you all, especially Chair Miller, for testifying in the House Housing Committee. So HB 2100 modernizes, like I said, the statute around homeless services, and it expands the table for organizations advising our agency on homeless services, which is huge. It calls out the use of evidence-based practices for addressing homelessness and the need to work on unsheltered homelessness in particular. We have one of the highest rates of unsheltered homelessness in the nation. So this is like so critical. Even more importantly, it also makes big progress towards our racial equity goals. So it defines and creates performance expectations for culturally responsive organizations and services addressing racial disparities. One of the most controversial components of the bill was actually creating a task force to explore opening up the ability for OHCS to fund organizations in addition to community action agencies, which essentially allows us to allow culturally specific organizations and BIPOC-led community organizations to directly work with the state, which is a big deal for us. Really great news that bill passed unanimously out of the committee and is now on its way to Ways and Means to support the cost of the task force. So I'm personally very, very excited. It's been a long time coming, and I'm really excited to see this progress moving forward. I think in terms of the American Rescue Plan Act, we are bracing ourselves, as I know many of us are, for another big influx of federal money, which is awesome. The legislature, as you all know, is kind of busy developing ideas for how we invest some of those one-time dollars. And I'm pumped. I think many of you all remember in January of 2020, we had this really great convening around the co-location of affordable housing and early childhood ed. And in the midst of COVID, it just went plop right on off. And so we're really excited to begin to kind of revive this conversation again around co-location. We've actually been able to help support get that issue raised on the radar of the governor's team and legislators. And there's several folks who are really, really interested in this. We're still obviously in the early phases in early thinking, but we're certainly excited to have this back in the mix. I know I am personally. There's so much momentum, I think, around this. And I think we just will continue to look forward to working together with the council and with the early learning division on this to see if we can get anything to shake out from these federal funds. In terms of agency resources, we just have to continue to remain laser focused on providing as much rental assistance as possible, emergency rental assistance that really focuses on keeping Oregonians in their homes. Rent assistance is out and it's in communities through the community action agencies. And we're also currently administrating the landlord compensation fund and wrapping up that first round of that program, which gives some assistance to landlords who may have tenants who haven't been able to pay their rent because of the pandemic. The first round provides some assistance to about 12,000 renter households, and we'll be rolling out another 200 million of federal rental assistance in May. So we've got lots more money getting ready to hit the streets. We're really excited on the home ownership front in terms of resources because the American Rescue Plan Act also includes dollars for mortgage assistance. And so Oregon will be getting $90 million to help keep homeowners in their homes. And we have lots of planning to do on that new program, and we'll keep you posted. I think the important thing about all of these resources that we know that children and families are the ones that are accessing these rental assistance dollars and these mortgage assistance dollars. So this resource is really, really critical for stabilization for children and families and for young children and their families. And then lastly, just kind of on the development front, I always talk about our development side of the house as our sticks and bricks, the folks that actually put money out on the ground to build the actual housing. And so in the midst of this pandemic, we have a ton more resources out on the street now more than ever for affordable housing development. Including, I think we've shared this at the Children's Cabinet and at past Early Learning Council meetings, our local innovation and fast track program, which is really geared towards both serving rural communities and communities of color, but also doing so in a way that supports families and really encouraging our development partners to have more family-sized housing. So not just studios and 1 bedrooms, but 3 bedrooms and maybe even some 4 bedrooms. And we're actually, I had the pleasure of being on the scoring panel for this most recent round. And so we definitely hope to make announcements this summer for kind of a new round of projects. I'm thrilled. I feel like as someone who's been on many of these scoring rounds, every round I see more and more folks talking about the connection between early learning and housing. And they're literally trying to build housing that reflects that value. And so I'm just really excited, and we'll look forward to coming back at a later date and sharing some of those projects with you. So that's what I have. Appreciate you all.
Awesome. Thank you, Chelsea. We appreciate you as well, and Margaret. So thank you for filling in for Margaret and all of the great work that you're doing. There's some very exciting parts coming into the housing world these days. So, right. Kate.
I'm happy to go. I have 4 things, similar topics to Chelsea, a little bit on the legislative front. The Cover All People, so that's covered in House Bill 2164 and House Bill 3352. They've moved forward and are still alive. And so that's pretty exciting. It would cover undocumented young adults 19 to 26 and undocumented parents. And then House Bill 3352 would cover all undocumented adults under the 380 or 338 federal poverty level, percent of poverty level. So that's exciting. We just are continuing to get more and more of the population covered with healthcare. We go from the big down to something that's really pragmatic, but a part of our RURAC plan. House Bill 3379 is alive, and it prohibits crib bumpers in the stream of commerce in Oregon, which is really exciting because this is really something, it seems so basic and pragmatic, but it will go a long way in terms of reducing infant sleep-related deaths. Some other states have done this: Maryland, Ohio, New York, and the city of Chicago has similar bans. So it's a step forward in that work, which is really great. There's a lot on the legislative front with behavioral health in terms of increasing access of services and growing the behavioral health workforce that's still alive. On the equity side, we've got House Bill 2088, which will expand tribal traditional health workers, as well as House Bill 2359, which will improve healthcare interpreter workforce, which is really exciting and awesome. So I think that's it on the legislative front for some just highlights. The American Rescue Plan, for the second one, like Chelsea, I think we're all waiting for more guidance at the federal level as to what this is going to look like and how we can use the funding. However, we will be taking advantage of some of the Medicaid expansion pieces. So one of them is expanding Medicaid coverage for postpartum women from 2 months to 12 months, which is awesome. Pregnant women will also be eligible for Medicaid at a higher threshold, so 190% of poverty, federal poverty level, so that the women who were 138 to 190 currently would be covered. And so that's pretty exciting. And then there's some increased match rates for some of the populations and scenarios. So that just helps save general fund and draw down more federal dollars, which is always helpful. There's some funding that's going to be going to supporting 30 additional, or part of the 30 federally qualified health centers. There's some expansions in there for National Health Service Corps and the Nursing Corps for loan repayments, which is really going to be helpful for our healthcare workforce. And the one thing I did want to draw your attention to is, if you haven't seen this policy agenda, it's the prenatal to 3 policy impact. It gives a really nice summary of all the components that are in the ARPA that relate to prenatal to age 3. And I did want to call out one thing, since this is my little baby, but it's also very much in the RUA Act, is under additional funding for home visiting, they specifically call out more maternal, infant, early childhood home visiting dollars specific to fund the Family Connects model. So the total for the country is only 150 million, so it's not a supplemental fund, so it's not a lot, but you know what? Every dollar helps. So, so I encourage you to look at this. I think that it gives a really nice summary of what's in there, and when we get more guidance from our federal partners and the legislature grapples with this, we'll have more of a sense of what's going to happen. The third thing I want to touch on is we are working on our Medicaid 1115 waiver. We do this every 5 years. This is the big waiver that allows us to gain flexibility in our Medicare program, and what's allowed us to do the CCO managed care model. And so the application is due to the Center for Medicare and Medicaid Services, CMS, in December. But this July, we'll be doing some presenting of the different concepts. So we'll get a sense of where the thinking is going. I can get you some handouts. I think we've done some presentations on this. Currently, our focus is going to be on equity, on improving transitions, such as across the juvenile justice system, the state hospital, aging out of foster care, some of those transition points, ensuring stability of coverage, because we know that that's a real support for families, and then social determinants of health investments, especially as it relates to housing, and letting the community manage and direct some of those investments. So I'm really excited about this shift to social determinants of health, because we know that we can't get the health outcomes that we desire using the traditional methods of fee-for-service and clinical care, that it really has to come from that community-based system of care. So hoping that we can bust open what that looks like and how that's reimbursed for those services. And within that, there's a lot of focus on children and families. Steph Jerem, who is our OHA Director for Health Policy and also sits on RUA Act, is leading that charge. So if you have any great ideas, we can connect you up with Steph. And the last thing I want to touch on is just a follow-up from what I think you heard in the February meeting around the health aspects of kindergarten readiness. This is looking at how can the health sector contribute to kindergarten readiness. And there were several metrics that we've been using to kind of create this gestalt, this package of metrics to move that forward. One is preventive dental visits for age 1 to 5, improving well child visits ages 3 to 6. And then the one that I think you heard about in February was the social emotional metric that CCOs will be working with. And the news this week was the Health Plan Quality Metric Committee, which is the Uber committee that creates the library of metrics, approved that the social emotional metric move into the measures library, the measurement library. And then next it will go to the metrics and scoring committee to grapple with what of that library they pull down and move into the CCO world. There are 11 CCO pilot sites that are testing out that metric that you learned about in February. I don't know who they are, but I can find that out for you. And it was voluntary. So I think there's more to come on that, but it's very exciting that it's moving through the different committees for support and implementation. So with that, I will stop and move it on to the next one.
Great. And let me just tag on to what Kate just mentioned about the metric. Council members, just a heads up, at our May meeting, we will have a letter of endorsement for that metric for our approval so that we can encourage the next layer, next committee dealing with the metric to endorse it and work with the CCOs on implementation. So that will be in our May meeting. So thank you, Kate. And Liesl, an update from ODHS.
Good afternoon. Thanks. It's a tough act to follow. I actually want to hit on 3 things, but something Kate said made me think to share this with all of you. Internally, we've been doing some reimagining what the future of human services will be, is happening right before our eyes. So we actually contracted last year with an organization called the American Public Human Services Association. And they've developed something called the Human Services Value Curve, and I'm hoping Angela can drop a link in the chat just to share with folks. It's similar, but not the same to social determinants of health, but it really looks to how do you move from a regulatory approach, something like you're eligible for SNAP based on income, family size, etc. You come in, we approach you and the customer in a very transactional way, and then we send you on your way with the one thing that you might qualify for, or maybe 2 or 3. But we don't necessarily serve the whole person in the community. And we'd like to get to what they call the generative approach, which is really what's community asking for human services in their community, and how can government walk alongside community partners to deliver services. And I'm looking at Peter because you do this and you've led it in your local community. And it's really the type of work that you've led that we'd like to be more of a partner, as opposed to sort of the big agency that you come into, and you know exactly what I'm talking about. So anyway, it's a significant shift for us as an agency. And what I'm excited about with the Biden administration is it's clearly where they're headed. And so it's a nice time to be visioning and looking to where can we align with some of the future strategies that are coming out of this administration. So just wanted to, it's kind of some of that behind the scenes work that we don't often talk about, but we just wanted to share that in the spirit of the other agency updates today. Probably 3 big areas of focus that I wanted to talk about. Obviously the legislature, and I was going to mention House Bill 3379, but Kate did. Last, or I should say 2 years ago, we operate a critical incident review team. So when there's a child death that meets certain criteria, we review what happened, looking back, what are some of the lessons learned going forward so we don't repeat the tragedy that just happened. And what we've learned is safe sleep and addictions are the 2 primary reasons for child deaths, particularly under 2. And so this bill really addresses one of those systemic solutions that hopefully will prevent future deaths. So just wanted to kind of make the connection between the CERT process and the reason for that bill. I could talk a lot about the legislature. We're kind of in that waiting game right now in terms of we've completed our Ways and Means presentations. Actually, I think went well. The remote environment is different, but it in some ways works nicely to actually get all the way through your presentation. When I don't know if other agencies' experiences, when you're at the table, you often get peppered and don't get all the way through. So there was an upside in terms of that. New committee members for us. So a lot of education, but the governor's budget, as I've mentioned, has been very favorable, and I do think legislators are looking at that as a starting point. So that's promising. I think the two things that have really consumed us the last year is both COVID for obvious reasons, but the fire response. The day the fires broke out, we didn't have an emergency management director, and we now have a department of emergency management. We're basically helping shelter about 1,000 folks a night, feed them 3 meals a day actually all around the state, just because we're sheltering people in hotels. In a COVID environment, you would normally, pre-COVID, you would have people in a gym on cots, and you'd bring in kind of a food line. And because we're not sheltering people in a congregate setting, we're working really closely with hotels to make that happen. And it's expensive, and it's long-term housing solutions are a long ways off, and we're gearing up for this year's fire season. So I think humbling for everyone across the state on what happened last year, and the need to be better prepared as state agencies and to support our local communities who are the ones on the ground really doing that response. We do currently have an RFP for community-based organizations to provide wraparound services. It closes tomorrow, but I'll put the link in the chat. Hopefully, we've done a lot of outreach about the opportunity, but want to make sure organizations in primarily the 5 fire impacted counties know about that possibility, and hopefully we've pushed it out through your networks, but we'll talk offline. Okay, good. Want to make sure. We connected after the last ELC meeting and connected our fire responders. So tangential value, Sue, to this group. And then, of course, our work with the COVID response and recovery unit with our partners at OHA. Right now, the focus has really been on vaccination, making sure particularly populations that may not be aware or may be skeptical or just have different challenges to getting access to the vaccines or getting those. So that's a big focus of that partnership right now. And then I think just the last thing I would hit on is pandemic EBT will be rolling out probably end of June this year, and that's $825 million into the state of Oregon. So we're working closely as we speak with ODE on making sure we get the right names of families to receive those benefits. So that'll be an infusion into the state over the summer. So I think that's it for now.
Wow. As always, there's a lot going on in our agency partners and around the state. So thanks, Liesl, for that update. Okay, let's then just, Maryam, sorry. Why do I always lump you elsewhere?
I'll be quick.
Oh, you don't have to be quick.
Okay. I will go. So I'll start with COVID response. We have continued with some of the, I think, key supports to emergency childcare providers and facilities. April, we started a distribution again of a PPE, another 3-month bundle. I think in the first 2 days, we had over 800 orders. So this is masks, wipes, super exciting. We anticipate we'll probably need to do one more round of 3 months. But we are continuing to work on that. Providers can order in English and Spanish. It's available as well to our family, friend, and neighbor caregivers. We have approval to do another round of emergency childcare grants. So this would be round 5 of the grants program. This is non-competitive. this is some of the funding through CCR, through the stimulus package that passed in December. Really thinking about this as bridge funding. There's a lot in ARPA. Alyssa and I are going to talk about this more later on in our meeting. So won't say more than that, other than to say we have some approval to disperse some funds. It's been since December that we did ECC4. So we think it's there's a need to get some additional resource to providers to help cover some of their cost of operating during COVID. So we've been working on that. Continuing to collaborate with ODHS to keep the emergency ERDC rules in place, including zero copays for families, the increased eligibility requirements, et cetera. They've been in place since last March. We are working on revisions to the OHA ELD COVID-19 health and safety guidelines for providers. So the summer amendments, we're calling them, will be out on May 15th. I think similar to what Colt said, it's this takes time. We started working on this months ago. The situation continues to change. We're continuously working with OHA to really strike that balance of making sure that childcare continues to be safe for staff, for children and families, leveraging everything that we know, both from the science as well as what we continue to learn and hear from providers about the practice, what's most important to stress, where they need flexibility, and really take all of that into account and kind of strike the right balance in terms of safe childcare. I would say, we are looking where we can provide more flexibility. Even we know is that the moment we're in right now is a challenging one. I think a big lesson learned is, the less well-controlled the virus is in the communities, that has an impact on childcare. So that's all we can always do. Our part is to get vaccinated, wear our masks, do our part. Everything that we do in the community, whether we're using childcare or not, makes it safer for providers and for families to be able to utilize childcare, and for children to be able to return to in-person instruction. I think, what we're learning is the use of masks, the exclusion of individuals who are sick, and vaccinations continue to be some of the most important areas to stress as we look at, the emphasis of what we put into those guidelines. In terms of summer learning, just to build on what Colt and Mary Louise already shared, there's $13 million next week. The Early Learning Division will be announcing applications again for summer learning opportunities for expansion of Kindergarten Partnership and Innovation Fund activities, Equity Fund, Oregon Pre-Kindergarten, Prenatal to 5, and Preschool Promise. So we did a letter of interest about a month and a half ago. We got some feedback about that. We know one of the questions and feedback we got is some flexibility to be able to do hybrid options. So we've taken into consideration. We're really excited. You're going to hear later in our meeting from some of our research partners and some of the listening that we've done with families around their experiences with COVID. And we know there continues to be a lot of fear among families around COVID. There also is a lot of concern about from families about their children really missing out on, on some of those learning and development experiences, getting together with other peers. And so, I think we're going to really look to our partners to work with families and know their communities and really figure out how to strike that balance right now in this time that we're in of meeting the various needs of families at this time. So very excited about the summer learning, all the summer learning opportunities that we have and supports that will be available to families this summer. In terms of session, we're continuing to track a number of kind of priority bills. There's continues to be a lot of focus around the suspension and expulsion issue in our state, both in terms of, the resources that we need to build up in the state, part of the governor's Racial Justice Council legislation. So we're continuing to track that really closely. We know that is going to be very important work in the next couple of years that we're hoping that we will be able to invest in. I know is a priority for the council, the tribal governance and the tribal hub is also a part of that legislation. We are tracking and feel that things are moving forward. Also, a couple of bills related to background checks and OCC, some to expand background checks as well as give the division also some needed flexibility to align with some of the federal rules around background checks. I think is going to be critically important as we, start to hopefully transition out of COVID and some of our federal waivers, and which has been giving us ability to do some expedited background checks right now. So we're tracking those. We've also completed our first round of Ways and Means presentation. So we'll be looking to kind of come back to Ways and Means. And that will be an opportunity to dive deeper into our agency requests, including the governor's requests for expansion of some of our early learning programs. We also, I should mention that, ODE and ODHS, the governor's office and ELD continue to work on the governance bill and legislation. It passed another important milestone this week through Rules Committee. So we'll be headed to Ways and Means. We've been working on the fiscal for that. And so that will really be the time as, it gets to the budget committee to really kind of dive into some of those details. So I know Alyssa will be, supporting all of you and kind of understanding that as we talk about that in Ways and Means. And then I guess last but not least, I'll sort of close with saying that I'm, in addition to, a transition and lots of other things that are going on at ELD, I'm really I think just feeling very excited and encouraged by, how hard I think the team is working with so much that's going on. I think in the next couple of council meetings and through the summer, we're going to start to hear about really, I think, other work that was timelines were pushed back or delayed, like preschool standards, some of our PDG projects, really important opportunities aligned to Raise Up Oregon. We really wrote, a lot of our PDG, which is very focused on systems building and aligned to Raise Up Oregon, really being able to move now. So I think we're hitting kind of our stride or, getting used to just what is now kind of coexisting and operating in the state of operating with COVID and emergency childcare facilities, and just really being able to move a lot of other really important work that I felt like was sort of stalled for a while. And so I'm excited about that, and that the team is going to be bringing some of those things to the council, because I think there's really exciting systems building opportunities to further our work, especially in early care and education. So you may be seeing, lots of RFPs for, lots of really exciting projects, like a new fellowship program for at the state level for the next, early childhood systems leaders, to build the next generation of diverse early childhood systems leaders in our state, to be able to do fellowships in various agencies or state government, or, opportunities or partnerships to be able to add racial identity development standards to our early learning guidelines, or lots of really cool things coming down the road. So we're starting to move those things through some of our contracting processes. So I'm excited that you'll be able to dig into those in the summer and the coming months. So I will stop there.
Wow, nothing like, yes, continuing the momentum, I would say, and very exciting, very positive. Council members, the rest of council members, how about updates from around the state and your perspectives? Okay, I'm just going to randomly call on you just to move this forward. And Peter, since you were sort of held up by Lisa, we'll just start with you.
I went first last time. Anyway, I'm glad to go first. I'm glad to talk what's going on. In our region, part of our learning community did write to the department asking for flexibility on the rules, especially as we try to staff back up. So I'm hoping those get addressed in the May 15th guidelines, the concerns that were raised. We held our first preschool K-12 summit in April. We did twice, once on a Thursday evening, once a Saturday afternoon. We had 84 participants total. It was a blast. The energy of just bringing together early childhood educators, kindergarten teachers, principals, and we had family representatives there as well, was great. First thing we did was put people into chat rooms and let them just talk to each other for a while. And then we brought them back out. We did an overview of the guidelines, the early childhood and kindergarten guidelines, and many of the people in the summit had not experienced the guidelines, did not have information about them. So it was great for them to get the information. And then we went back into breakout rooms so that people could talk about different sections of the guidelines, how the guidelines are put together. And then I had a kind of open discussion about how do we bring this information the best way to parents and guardians? How do we get this information? Great conversations. Sue was able to join us for part of the Thursday evening session. What came out of it was 3 different work groups. One work group to work on how translating the guidelines into really simple information for parents to use and understand. Another group is working on a consistent student information document from every preschool in the region to be able to use the same document to list information about the kids that they're passing on to the kindergarten teachers. So there's a group working on that. And the third group is working on a longer all-day summit in August. We're going to bring everybody back together and really try to get some more focus on that, making that transition from early childhood into kindergarten successful. We're also starting our pilot project with Family Independence Initiative. We're working with the Healthy Start program in Josephine County to recruit families. And we also are doing 20 families in Jackson County. Family Independence Initiative has a great track record of helping families get out of poverty. Looking forward to expanding that as we go. And we're working on developing a behavioral health workforce pathways, different pathways into the workforce. Southern Oregon University is developing a micro-credential program. We're aligning that program with the trainings that are offered by the SOESD and other community partners like Jackson County Mental Health, et cetera. The idea being that if we can get people in early childhood or in K-12 who like working with people, who might want to look at becoming part of the behavioral health workforce, or at least scaling up in behavioral health school tools, there'd be a place for them to go with a central registration, a master calendar for the year so people understand which is being offered at which time, infant behavioral health, youth mental health, which kind of programs we're offering. So that work's been exciting, lots of good cooperation from a lot of folks. So that's what's happening in Southern Oregon.
Wow. All right. Thank you, Peter. Anne, since we're sort of down south.
Yeah, Peter, that was so impressive. Wow, that's really great. I just want to, first of all, thank Liesl, because she really did reach out to a lot of different folks. I know she's not here, but to think about the wraparound services, because especially for fire affected families and communities, and it was really great. And that connection was made through this Early Learning Council, and I really appreciate that, because I think we were able to expand the networks that way. And I guess just say a couple of other things. I think that where we are is a lot of people still feel really destabilized by school is sometimes in and sometimes out, and really hard to manage. Parents are having trouble managing the sometimes in and sometimes out. And actually in Douglas County, we're one of the places where we're moving in the right direction in terms of the COVID alert designations. And so that's good. But I think there's just such a feeling of destabilization that it's really hard for people to manage and sort through what's going on. And especially kind of sorting through the massive amount of new funding that's coming in, really, and trying to match that up against the SSA plans that people had developed, and trying to align all of the plans that they developed in response to the Student Investment Act and the new funding there, and also the other things that are kind of keeping people jumping all the time. There's this feeling of instability, not sort of the next squirrel has come and what do we chase? And so that's kind of the general sense that I want to convey. A couple of things I want to just talk about specific to Douglas County. We've done a lot of work recently to try and develop an infrastructure for community school family liaisons with ESD, with us, the Ford Family Foundation, and other community building partners. And I think this has the potential to have really nice traction and be filling an important gap. And then the second thing I want to say is that we're still working and deeply working on building the childcare infrastructure in Douglas County. We're convening all of the providers. We have the shared services pilot that we're doing in partnership with OCF in Coos County. But I think but it all adds up to us moving toward a much more comprehensive strategy in Douglas County that includes listening to the providers what they need, business supports, workforce training, getting an understanding of how the financing works, and so on. And I think that that's something that's very exciting in Douglas County that I hope can be helpful to others as time goes on. And there I will end my report. Thanks, Sue.
Okay, thank you, Anne, very much. Angie, how about your update?
Sure, thank you, Sue. So we had temporarily reopened. We were very happy to have kids back on site here at our preschool on the tribal campus, and that lasted for just a couple of weeks. So last week we ended up having to put a pause on all of that because there was an outbreak in our community, not on our campus and nobody in my school, but in our community where children riding the school bus, who live in tribal housing, who live with other kids that do go to school here, a lot of reasons, but we ended up having to put a pause on that. And I really hear what I think it was Anne just now saying about how destabilizing this is for families to be open and then closed and opened and closed. So really, really distressing. And I won't even know until Friday if we are free to open up again on Monday. So initially we were on a 2-week pause, but my staff has said that's what they said last time. And that was pretty long closure. So I'm really coping with a lot of those uncertainties with my staff and with the parents in my program, who have all been really, really wonderfully patient and know that these things are out of my control. The tribe has administered 17,000 immunizations or vaccines, and I'm really, really, really pleased about that, being able to open that to the community. I understand that the last vaccine clinic they had last week was the last time they're going to offer to the first time patient. So the clinics that they have here on out will just be to continue completing that series, the second vaccine for most people, unless people are tribal members or employees here of the tribe. I think that's about all I was going to share today. Those are the really main big things for my community.
Okay, thank you, Angie. Sorry about the closures again. I know they're tough. They're really tough. Peg, what do you see in the healthcare world?
Well, we certainly are seeing more COVID cases. We had gone, in our small hospital, we had gone a couple of months without, we'd seen some in the general part of the hospital, the medical surgical floors, but none in the obstetrical units. And we've seen an uptick in the number of cases. Fortunately, no one who's been seriously ill, but I think that's a little discouraging. The sort of encouraging things are that the schools are opening up, and I think that's a really positive thing. We have seen such a increase in the number of mental health issues amongst pretty young kids, pre-teens and early teens coming to our emergency department. And there is such a dearth of services for those kids that I really think getting those kids back to school has to be a priority. And I think it was mentioned earlier that the number of cases in schools kind of mirrors the cases in the community, and that really is true. I think, again, it's one of those things where we have that sort of trade-off of having to accept perhaps a few more cases to get those kids back in school, because it's really an important part. We know nationwide that kids are probably greater than 20% of the new cases that are happening now. And I think until we can start to vaccinate younger kids, that's going to continue to be the case. I am encouraged by the availability of the vaccines for kids as young as 16, and the positivity sort of on a national level of probably that coming down within the next month or so to kids as young as 12. So I think that's really a key piece to getting schools open again in the fall and so forth. And we see fewer cases amongst those older kids. We're going to see fewer cases amongst the little kids too. So that's good. Child abuse wise, again, it's good that kids are back in school. We're getting, I think, a better idea of kind of the stressors that families have been under and the effects that has on kids, and trying to reach out and help those kids as well as help those families deal with those situations. The early intervention hat that I wear, boy, those kids have really taken a hit this year in that we haven't been able to do in-person assessments, and we're lagging behind. We are able to prioritize those kids that are going to kindergarten to get them assessed. So hopefully we're not going to fall too far behind with those kids. But again, I think there's lots of work to be done. I guess that probably two encouraging things. I was on a webinar not too long ago where they were really talking about these healthy outcomes for positive experiences with kids, this HOPE kind of model that is like the antithesis of the ACEs model, and how protective that can be. And I think it's so easy. Those positive experiences can be so easy, just talking to your kids and reading to your kids. And I think if we can get that word out to parents, that can maybe help to mitigate some of the stressors that have happened. And the other really positive thing is this thing called Project Oasis, that is a new sort of public-private partnership happening in Yamhill County, mostly in Newburgh, with ADEC, and the county has put some money into it. And it's really designed for childcare, to expand childcare in the region, in the county. And the model would be that businesses would kind of buy slots to this for their employees, and then there would be a certain number of slots available for low-income families, and there would be a subsidy so that hopefully providers would be appropriately paid and the cost to families would be affordable. It's kind of in the discovery phase right now, but it really sounds encouraging to me. And that's one of the more encouraging things I've heard about childcare in a long time. So that's kind of it from my perspective.
Okay, thank you, Peg. Great overview. Let's see, Kali, what's happening in your world?
Hi, can you hear me okay?
Yes, we can.
Great. So obviously I'm in Multnomah County and Portland. Never a dull moment. I think one of the big things that's occurred since we last met is the announcement of the closure of the Children's Museum, which is a centerpiece and I think a really important part of the community. It came as a surprise, I think, to many. With the closure of the Children's Museum is also the closure of the Opal School, and Opal is both an elementary and a preschool. And so there have been a lot of conversations. Many of you probably don't know, Kairos actually studied Opal and met with Judy Graves, who is a early learning leader, I would say, who went to Reggio, Italy to study the Reggio model and built the preschool around the model. And she was really instrumental in our founding. And so we and others who really believe in the Reggio model, which really centers children and the brilliance of children and the belief in children and building community around children, have been having conversations about how do you preserve all of the rich research and work that went into both the preschool and the elementary. They had people all over the world learning from them about their practices, and Teaching Preschool Partners is another partner that does work in Park Rose that takes this model out. And I would say both with Teaching Preschool Partners and the work we're doing, serving really diverse communities with this belief in Reggio. So it was a big shock, but it's good to see that people are talking and working together to figure out how all of the good work lives on. And we are looking at potentially having a preschool bring some of the work to Kairos. But I know it's a bigger conversation that's happening with a lot of folks in the region that I'm relieved because it really was a special place. And if any of you don't know about Reggio, I won't spend a lot of time talking about Reggio model here, but it's worth learning about. It's very good for children, I believe. So that's been a big thing. The Preschool for All effort that was finalized in November. They hired a director, Leslie Barnes, who's led the Focused Child Care Network for African Americans with the CCNR in Multnomah County region. She was hired as the Preschool for All director. It's a huge job, but it's very exciting that we'll be able to operationalize this work. And I think for those of us who have been engaged are excited to see what happens and what it looks like. And of course, the work of Preschool Promise and other programs that were focused on mixed delivery models of early childhood are being taken into account as we think about what does this look like to provide a mixed delivery model to an entire region. So that has been very busy. And then I guess on another exciting note too, I would say every organization that is serving large swaths of the African American community have been part of a conversation to start a Center for Black Excellence. We've got some initial funding now. The Portland Public Schools got funding for the bricks and mortar part, but it's a community collective project that hopefully will involve the entire community. And the idea is supporting the continuum of education from birth and really, I would say, maternal health all the way through to higher education. And so we got some initial funding to start the planning of that, and we'll be hiring a consultant and doing some communication. So that's a really big and exciting thing for the community that I work with. And then I think finally, on a more somber note, there's been a lot over the last couple months when it comes to racialized violence. This is Asian American Heritage Month. And over the last couple months, we've obviously seen it's been more visible. The hate crimes against the Asian community have been increasing something like 900% over the last year. It has a lot to do with the coronavirus and attributing it to a geographic region. But the visibility of it has had a huge impact on our Asian community. Kairos works a lot with a lot of our diverse partners. And so, seeing how that's been impacting them, the trial of Derek Chauvin, has had a big impact on the Black community. So there's just been a lot when it comes to race lately. And in a lot of the meetings that I sit in, people are talking about just the trauma of that, what it means for families, what it means for children, how to support children and families who are listening to these messages of violence and assault against their people. And so that's the somber note. It's the reality. I think a lot of people are trying to figure out what are the solutions, but more than anything, I think we're just trying to show solidarity with one another and community, that this community is made up of all of us, and it's not one group versus another, but how we collectively can support one another. So I guess I'll end on that note. It's good to see all of you today.
Thank you, Kelly. Yes, there's certainly good news and challenging news. Before we go to George and Katie for your updates, we need to jump to the next item in our agenda because we have two guests who have been waiting patiently to present the study that they have done and the reports that are included in our packet. So George and Katie, please hang on because we will be back to you as soon as we talk with and hear from both Beth and Catherine. So Beth and Catherine, I apologize that we are running behind schedule and want to thank both of you very much for being with us today, as well as for the great work that you and PSU have done for years and years and years in helping us understand early childhood and the challenges that parents, providers, etc., are facing. And these two reports are very informative and a little staggering, but let me turn it over to the two of you and ask you to share the reports with us.
Thank you. And I'm going to very quickly share my screen and make sure that everybody can see it. Can everybody see the slides? Okay, great, thank you. So thank you for the opportunity to present the information today. My colleague Beth Green and I have been working with the Early Learning Division for a couple of years now on the PDG projects and doing a variety of surveys. And this is what we're going to present today are actually the results from surveys and family listening groups that we did at the very end of last year to really get a sense of the effects of COVID on childcare experiences for families across Oregon. So just to start out, and can I just check to make sure my slides are advancing for everybody? Okay, great, thank you. I just want to recognize the folks who have helped us on both on the research team. That's been folks from the Early Learning Division itself, as well as at Beth's shop, the Portland State University, and then I am a senior scientist at the OSLC Developments Incorporated in Eugene, Oregon. And all these lovely people helped us put together the stuff you're going to hear about today. So the Strengths and Needs Assessment, the PDG Strengths and Needs Assessment of 2020 was building off of work that we did in 2019 before the pandemic, in which we had really looked at the experiences of families across Oregon in terms of finding childcare and what their needs were. And as the pandemic closed in on us, and as we started to hear stories about parents having difficulty finding care, and as somebody brought up earlier, the changes and the closures and the reopenings and the reclosures, the ELD really felt like it was necessary to look into this and try to understand how families were experiencing these things. And we also at the same time wanted to hear from families about the cultural responsivity of early care and education services, because in 2019 we'd heard loud and clear from a number of families that they were feeling that their care wasn't responsive to their cultural and linguistic backgrounds. And so we wanted to hear more about that and to see what had happened in light of COVID. and the many events that happened last year. So we have two components that we're going to talk about today. And the first was statewide, we had a household survey that went out to all families of children or all families who had children from the ages of 0 to 5 in the state of Oregon were eligible to participate. And then because we had found in the first survey that we didn't necessarily get a lot of responses from traditionally underrepresented families, we wanted to do a special reach out and elevate their voices. So we did family listening sessions with a range of families of color, as well as families working who had children experiencing disabilities or chronic health needs, and those in frontier regions. So we'll be telling you about both of those today. Starting with the household survey. So again, the household survey was open to any caregiver, bio parent, foster parent, grandparent, family member of a child from the age of 0 to 5 in the state of Oregon. And as you can see, the vast majority of those who responded were mothers, biological, adoptive, etc. They were within, the median age range was 25 to 39. The home language for most folks was English, but also 20% of the respondents spoke Spanish, and then about 6% had another language such as Arabic, Swahili. There was quite a range. Most of the respondents were from urban areas, but we got a good chunk of folks from rural areas and also from the frontier areas. We looked at income and split folks into two groups. One that was above 200% of the poverty level, and then those families that were at or below 200% of the poverty level. And that's a fairly even split with perhaps a little bit of overrepresentation from folks below the federal poverty level. And then we also asked whether their children were experiencing a disability or chronic health needs, and about 16% of the entire sample was. We asked parents to pick a focal child. So in this case, we asked them to take their eldest child who was 5 or below, and report on that child in terms of childcare. And so what you're seeing to your right in this slide is the race ethnicity of the respondent's focal child. So that focal child, and we got a fairly diverse sample for Oregon. That is representative of the distribution and diversity of the state as a whole. We started by asking families about whether they had their child in childcare for 8 or more hours a week since March of 2020, March being the marker of when a lot of the shutdowns happened. And over half, 53% of those families had a child in childcare. Of those families that did not, so that 47%, about a third of them, over a third, had looked for care. We asked families who had a child in care what kind of care they had been utilizing since March. And in the graph here, you'll see that the teal bars are the percentages for 2020, and the sort of grayish brownish taupe are the percentages for 2019, just to give you an idea of how things had changed across that time period. So what we see is that folks who were reporting that care was in the child's home with somebody who is a non-family member, so someone who is a nanny or a babysitter coming into the home, was at 51%, which is quite a jump from what it was in 2019. The other categories, a non-relative in someone else's house, which a type of care that's often called family-based or home-based care, was about the same as before, and center-based programming had gone down slightly. And then the other two types were elementary school-based program and a relative's home that we didn't actually ask about in 2019. When we wanted to find out from families if their care had been disrupted by COVID-19. And so we find that the majority of families, about 60%, had some sort of disruption in care across this time period, and that those disruptions were not equally distributed across all families. So families of African American and Black children and Asian children and those with children with disabilities or chronic health needs had disproportionately were experiencing disruptions in their care. We also asked families about their use of services or services that were offered to them in this time. So we knew that lots of folks were, or numbers of programs were providing things like Facebook or classes online. And so we asked families if they had been offered a range of services. So that's your orange bar on this graph. And you'll see that a large majority of parents reported that they were offered the opportunity to have some sort of online live contact with teachers or to watch recorded videos from their teachers. Fewer families were offered the chance to have meals, to either come in and pick up meals or have those meals dropped off to them. And even fewer were offered the opportunity to receive supplies such as diapers or sanitizer. The green bar is of those families who were offered the services, how many of them actually use them? And you'll see here that most families who were offered either live or recorded classes online were in fact utilizing those services. But also of the folks who were offered things more, let's say, more sort of survival stuff such as meals and or supplies, a majority of those families were also taking advantage of that. And then the teal is out of the families who use the services, how many were satisfied, reported being satisfied or very satisfied. And here you'll see that again, even though these services of meals and supplies were not as often offered, in fact, families who use them were really satisfied with it. And it really kind of speaks to perhaps a need that wasn't always met, but that when it was met, families really were really appreciative of that. We also asked families about their concerns about returning to care. So what, in going back to care, or if they were either contemplating going back to care or they had gone back to care, what were their biggest concerns? And so top of that list, probably not surprisingly, the vast majority were concerned about their child or their family being exposed to COVID. Another big chunk of families were worried about their previous provider not being open, and that has turned out to be true in some provider survey numbers that we have. There were also families worried about not being able to afford care or in fact losing their slot for care. And then families were also worried about not having the teacher be the same. Less worried about something else. And in that category of something else, families talked about being concerned that their child wouldn't be able to wear a mask or that their child wouldn't be able to get the same extracurricular activities they'd had before. And then finally, being concerned about having difficulty providing transportation. We also asked families how concerned they were about particular settings for childcare, and then what their preferences, given COVID-19, for childcare would be. And so as we can see here, this teal bar shows that by and large, less than half of families were concerned about exposure to COVID-19 when the care was in their own home, whereas across other types of care, so whether it was family or home-based, childcare center-based, or preschool and an elementary school, they were about evenly concerned. So, I mean, thinking about these, we could think about them as being outside the home care. They were concerned. When we asked them what their preferred care would be, whether they were in care or not, given COVID-19, we start to see not surprisingly, given their concerns, we see a good chunk of parents would prefer to have care in their child's home, but also a good chunk of parents are wanting their children to be in a center-based program in spite of this worry about exposure to COVID, which suggests that there is something of value in center-based programming in parents' minds that could override or at least compete with this quite reasonable fear or quite high fear about exposure to COVID. We also asked families about their challenges, their top challenges. So those families who were looking for care, that 35% that were looking for care, what were their challenges to finding such care? And again, the vast majority either were having difficulty finding the type of childcare setting that they wanted, or finding a provider who had open slots or availability. And then down through being able to find a provider who could help the child learn and develop, who had a location that they could get to, and a provider that they felt was well qualified. About 60% were concerned about finding a provider who had health and safety standards that they'd agreed with, which in the time of COVID, I think was probably elevated. When we asked about finding a provider who reflected your family's cultural background, about 31% said that that was a challenge. However, when we broke this down and looked at who said this by family, race, ethnicity, we found that it was not necessarily across children. There were a lower percentage of families saying that this was a challenge, but when you looked across the families, American Indian and Alaskan Native, African American families, all families of color, you were seeing, 50% or more really feeling like they were not able to find a provider who was reflecting their family's background. And I'm going to turn it over to my colleague, Beth Green, who can tell us more about the actual voices of these parents talking about that challenge in terms of finding care.
All right, thank you, Catherine. So the second piece of the project was really focused on making a concerted effort to hear some of the experiences firsthand from families who either were not well represented in our prior needs assessment that we did in 2019. So specifically, we hadn't been able to really engage in terms of listening sessions or stories told with American Indian, Native American families and African American families. And then to really hear from some of the same groups that we had heard from before. Again, and these are families who, often may not participate in household surveys or things like that, and who we felt would be worthwhile to really hear and expand and deepen our understanding of their experiences during COVID. A lot of these communities are, as you well know, disproportionately impacted by COVID in terms of rates of infection and those kinds of things. So this was a high priority for us. Catherine, you want to move forward? There we go. So this just tells you kind of more specifically who we reached out to. We did specific listening sessions, with different groups. We did 5 with tribal or American Indian groups across the state. We did some that focused specifically on the frontier region. We did a focus group with participants in, I'm sorry, it's hard for me to answer chats. So maybe Catherine, if you could keep an eye on the chats, and then at the end of the slide, I'll address any questions. So thank you. Children with special health care needs or developmental or other disabilities, and then African American families. So we did listening sessions, focus groups with these families, and we tried really hard to engage as many of these families as we could. As you might imagine, it was a little challenging to get families to give an hour to an hour and a half of their time, but I think we were able to have a good representation in the focus groups. If you want to move on to the next slide, Catherine. So what did we hear? And also, I just want to call your attention to the fact that posted on the ELD website now, we have specific reports for each of these groups. We worked in partnership with community organizations to engage families and made sure that we provided the reports back to those community group organizations as well as to the parent participants so that they could see what happened with what they shared. And hopefully they'll be able to see impacts at the system level of recommendations that come out of this as well. So the first takeaway is probably not surprising to anyone on this call, which is that really the COVID-19 exacerbated what for many families were already considerable challenges in accessing and affording high quality childcare. But that this just got much worse for many families. We heard a lot of stories of real patchworks of care, a lot of concerns that the quality of care that was available to families was lower quality. Also that it was lower quality and cost more. This was a little bit of a surprise to us, but we got some stories of sort of real, like, it almost felt like price gouging in terms of what people were charging for care because they knew that families had such limited options. The lack of just available care with everything shut down. We also interestingly heard a lot of descriptions of how virtual experiences were not meeting their needs, although we did hear that they felt like providers were doing all that they could do, that they were making an effort and trying to make it work. And I think that might be reflected in what we saw in the household survey. But from their perspectives, it was like, ugh, it's just really hard to get the child to engage, to have it feel meaningful, all of those things. And a lot of concerns. These parents were worried about their kids for a number of reasons, socially, emotionally, and in terms of their kindergarten readiness. And especially because they really sensed that the care they were getting was not what they wanted. So I wanted to share, I think, we synthesize the findings and try to pull them up into, themes, but it's really compelling to hear the quotes. And so I'm going to be reading quotes to you, which I recognize is not really best practice, but I think it's really important to hear the voices of the parents, even if we're reading them on a written page. So in terms of the challenges to care, we heard stories of desperation. Looking on care.com was really just out of desperation. I need my child to have daycare. I have to go to work. His dad isn't going to be able to care for him throughout the day like he has been. So I was just desperate. But like I said, I didn't want to go to anybody that didn't have good references from people that I trust. This is an example of the fees that they were paying. At my previous care provider, I only would have had to pay like $50 a month. Now you might wonder, is that enough? And right now I'm paying $250 a month for my kids to go to somebody for 2 days a week. So money-wise, it's been a big impact. And then pressure that parents were feeling from their employers, giving them messages like, come on, get on it. You have just a couple more weeks. Don't wait till the last minute. Feeling like, yeah, I don't think anybody's waiting till the last minute to find childcare. I think we've all been trying to find it. It's from a parent from the Klamath tribe. These worries about children falling behind, with the kids being at home, the socialization piece that they're missing, not just socializing with kids, but the developmental part of being away from your parents. Fears of not being ready socially, emotionally, or academically for kindergarten, even though I feel she may be academically bright, but I have that fear because I can't make that choice to make her go to childcare. Is this going to damage her later on? Is she going to really suffer when she gets to kindergarten? And then another tribal parent, I'm not able to afford somebody who's had years of experience. I can only afford these teenagers, and it's not their career choice. They don't understand developmental things about kids this age, especially from him coming from a Head Start to this. He's just not getting his needs met. All right. Our second takeaway was that even though parents had a lot of concerns over health and safety, they really felt constrained in their choices, either feeling like I've got to find care and put my child in care because I have to work, even though I'm worried about their safety and the quality of care, or feeling like, ugh, there's no way I can make the choice to put my child in care because of my concerns about health or safety, especially when things were happening within the family. There were people with elevated risks within family members. It's important to note that in terms of what they were worried about from the childcare provider side, it really wasn't as much, we didn't hear as much about not being, about concerns about what providers were doing in terms of health and safety for the children, but more this lack of control of what other families might be doing. So, right, how do I know what these other families are doing outside of the childcare that might be like a vector for me and my family to get children? Let's see. Okay, I think you could probably go to the next slide. So some of the specific things that folks shared with us. I just don't want my kids to fall more behind. This is especially from families with children with disabilities. They're already behind with their disability. My biggest fear this whole school year has been very hard. They only go a couple hours a day, and I'm scared that next year, when starting kindergarten, that they're not going to be where they should be for that grade. And then another parent who said, I was really getting bad with him not having the socialization. His behavior was changing dramatically. So I made the decision, if he's going to go back, he'll learn. He's already so far behind anyways. I think he needed it more than anything. So sort of feeling forced to make the choice for the child's well-being, even despite concerns about safety and COVID exposure. And again, some more around those constraints. Essentially, I'm a single mother. I don't have a second income, so I have to work. I don't have the choice to stay home, as much as that sounds amazing. And so much anxiety and stress would be gone, but I can't. I have to have a full-time job to support my son and keep a roof over our heads and food in our bellies. So those were the families who were often talked about being driven to make choices that were concerning for them, low quality for them, real patchworks of care, which we know aren't good for children. I can't afford not to work. There's no way I can't work, not just financially, but also for my own mental health. If I lost that part of me, it would be hurtful and impact me very negatively. And then another parent, and to either go back to work and look for childcare, that decision was made for me, with childcare just being too expensive. So that was not an option. So constrained in the other way. All right. And then the third takeaway, as Catherine was saying, we really were trying to understand the ability of parents to get what they felt like was culturally responsive and culturally appropriate service, and how that extra layer of systemic racism and the socio-political tensions and things that were breaking through in 2020 in terms of George Floyd, how that was impacting families. And what we really saw was that, yes, of course, we knew this. It was impacting them. They really, these families of color really see cultural identity as an asset for their children and really see it as foundational to quality care. Not like, oh, yes, it's nice if you can get that, but is really like, how can you even deliver quality care without it being culturally responsive and culturally appropriate, and strengthening those cultural assets, but really challenged in finding care that was that met that standard. So parents, as people on this call can probably guess, talked a lot about their own feelings of stress and overwhelm, their own mental health. These families were just hanging on by their fingernails. We heard a lot from our BIPOC parents about racism and how it really was impacting them before and was impacting them even more. Again, as they see that racial cultural background as an asset that needs to be strengthened and want their providers to support it. And again, the one exception I want to call out is that parents who talked about having their children in tribally run or tribally affiliated childcare programs or Head Starts, they really told us some lovely stories about the ways that their providers were supporting their tribal culture and identity. So there's some really beautiful models happening for families who have access to those types of services that we heard about. These quotes are all related to parents' experiences of racism and the impact of racism on their children, the impact of racism on their, even their ability to use childcare. So parents talk about, even if they try not to put it through a lens of racism, this Klamath tribal parent, I really tried not to go there, like, oh, someone doesn't like me, it must be because I'm Indian, but I did have to go there. I did think it must be something to do with who I am. I try not to go there, but experience is experience, especially in Klamath County. And then an African-American parent talking about how racial tensions have always been an issue, but during this pandemic, there's been a lot of times and places where I didn't feel safe leaving my house. I didn't want to go grocery shopping. There was a whole time when we were like, as a culture, passing on Facebook messages. The Proud Boys are coming to town. Get what you want to get so you're not out from this time to this time. And just what a toll that was taking on families' well-being. And then this other one, when you have to imagine if you can actually get home to your kids because you're this color that people hate, it's a hard thing. I think it ties into everything that's going on, the pandemic, including what we're talking about right now, which is childcare. How can I get across town in order for me to be safe, in order for my children to be safe? What if there's an all-Black childcare center and someone knows that and they try to burn it down or something? These things are real life. This is what these parents are experiencing every day. My children need to know where they come from, but I also hope they never experience some of the things I've had to in my past. Some really important voices. And then in terms of cultural identity, I alluded to some of this already, but just this very clear feeling that how important it is for children of color and Indigenous children to have a sense of their identity and where they're from. I think it's important because a parent says, I think it's important because it gives you a sense of identity. As you go through your life, you know who your ancestors are, you know the teachings, you know they provided you value. And I believe culture provides value. You're tied into something bigger than yourself, and to honor our culture is to honor yourself. So it's really teaches positive life schools. And to me, it's very important. And another tribal parent, I would say that a provider who can support culture is a #1 priority for me. I think that if my kids are losing that, we're losing generations that forget the meaning, the importance behind their traditions. It's really important that they understand where they come from, they understand the amazing things the generations before them did, and how they're overcoming all of the prejudice, all of the stuff that happens. And then finally, from a multiracial parent, long story short, my child needs to know who he is so he can better integrate in the world. So he can be okay being 3 races, being predominantly African-American, with what society standards are for triracial babies and the difficulties he will have in that, but also the positives that come from it. So I think that is a quick summary of some of the stories and experiences that were shared with us. I do want to emphasize, even though these families were struggling, a couple of big takeaways from what we heard was, first of all, families were incredibly resilient, right? So they were figuring it out. They were figuring out how to work, how to put the pieces together, how to keep their children and families safe. So just really, really extraordinary levels of resources, and also just this really strong, profound desire to prioritize their needs of their children, despite, the systems that maybe were already not working very well, really falling apart underneath them. And then related to this issue of taking the time to come and talk to us, one parent just said it so eloquently. She said, the reason we're here, the reason we took the time to show up for this listening session is because it's important to us to add our voices to the conversations, because you can't fix things for me without speaking to me about what the problem is or what it is that works well or doesn't. So I just thought that was a great, tribute to, again, the importance of including parent voices in all of our processes and decision-making about what needs to happen with the system of services for families and children. So I think that brings us to the end, and we welcome any questions or comments. I urge you to go and look at the full reports and the reports for the culturally specific groups, and there's lots of briefs that can be shared and downloaded.
I just want to thank you. Oh, sorry.
Yeah. Go ahead, Kelly.
I just want to thank you for, it was a really rich presentation with a lot of information, but you presented it in a way that really honors the families and the voices of the families. I really appreciate you talking about their resiliency. I think oftentimes we get this information and it's like, oh, these poor families are, it's the families challenges, not the children. And yet, as you articulated, families are resilient. Families are working really hard to support their children. Families love and adore their children. And there's just a lot of barriers. And I really appreciated the way you presented this information and gave us a lot to think about. So thank you.
Thank you. That means a lot.
Yeah, good point, Kelly. And I appreciate the amazing diversity of the families you were able to connect with, racially, but also geographically, income-wise. I mean, we will have a lot to learn from you. And how did you actually be able to get that kind of family engagement in this process as the council looks at potentially doing some listening sessions? We may well be calling the two of you to ask for advice in that engagement process.
It is all about partnerships with community organizations and really reaching out to, especially to those culturally specific organizations that know their families and that families trust. That was really a key.
Right.
I think it also
we
helps.
paid them.
Yeah, and I think, you know, honoring their time commitment too, and being able to say, yeah, this took time, and so, you know, being able to provide them with gift cards, I think also helps. If you know,
Not just paying the families, but paying the organizations to help us to engage families. I think that was really important and honored the resources of their staff who were also overtaxed and overburdened.
Yeah. Okay, good points. Good points. Other questions from council members or comments?
Yeah, I just want to say it's so incredible to hear you all report on this research and how lucky we are in the state of Oregon that we have your two institutions that can be asked a policy question and that you can go out and do this high quality research. We are so lucky to have you, Catherine, and you, Beth, here as leaders who we can always count on to turn to when we have crises like this, and you can figure out how and go get the information we need. So just kudos to you for being here and being so committed to kids and families in our communities. A couple of things I wanted to say and ask you to comment on. One of them was that came through to me in what you were describing was how hard the families of color have worked to make sure that their kids are in places that are culturally relevant, that support who they are, and how fragile they believe that is right now. And how, so we talk about resilience, and yes, the notion of resilience came through, but the resilience around sort of the cultural supports that they've built for their kids is they're really, it sounds like they're really concerned about that. And then a second and related thing was that slide that you had from in the very beginning, slide 4.2, about one of the things that was really interesting about was the high demand for sort of basic needs supports. The high number of families who took advantage of the lunches and everything like that, which is, I assume, is kind of an indicator of how fragile the people who are in the lowest income levels were during these moments. And so I sort of generally, my question to you is generally comments on both of those things. And then I think my bigger question for us as a council is, we knew that we had to take care of kids and we knew we had to take care of the families. But now, given this information that you're telling us, how do we support the teachers and the educators and the childcare providers when these kids come back in and they have been so traumatized and they haven't had the basic human needs or the cultural supports they've needed over time? And what is your sort of recommendation to us about things to focus on there?
Beth, you want to take the first question, and then I can talk about that chart.
I remember what the first question was now. I think it was related to the cultural assets and how families are working to try to find culturally responsive care. And I think, yeah, they really struggled. I think they struggle with that anyways. As we know, the workforce is not as diverse as we want it to be. So that's a huge workforce issue for our state that I know is, on your radars. The other thing I think is that there's a lot of families that I would say, that shared with us this feeling of they've kind of given up, honestly, looking for it in the system, and they use their family and informal supports for those things, and that's where they went during these times as well, because that's who was there, and that had positives and negatives, So really relying on those informal supports. So it's interesting to think from a systems perspective, how can our system better support those informal supports? And I know with, childcare, a lot of that's like, how can we build and strengthen family, friend, and neighbor care options, so that people of color have more culturally specific folks that look like them and can develop those assets and share those values with their children, live in the same communities, can provide good childcare and be resourced for it, paid for it.
And then an answer to your second question about the services received. Sorry, Beth, did you?
Nope, that was it.
I think that was the message that we really did need to be focusing. I think it was harder perhaps for providers to offer those basic survival kinds of things like food and supplies. I do want to say that in the report we split out the being offered those supports by income level, and families who were below the 200% poverty line actually were more likely to be offered those supports. So the good news is that the families who needed them actually were getting the offers. So that's good. And that came across in a couple of different ways. A number of families of color were also saying that they were able to get those supplies. So I do wonder, it does suggest that for families who were perhaps in need of those things, they were getting them, and that care providers are actually providing not just care, but kind of a network and a safety net for those families, which makes it even more important that we support them. And I will just sort of, to put in sort of a teaser here, in a complementary set of surveys, we've actually surveyed providers across Oregon about their experiences in terms of whether they closed and whether they're still employed. And we were able to look across the spectrum of different types of providers. So that information, I think we're still analyzing it. But I think once we get that analyzed, it can perhaps speak to some of the questions too about the culturally responsive providers and like, are they even still in the workforce as we see sort of the toll that COVID's taken? So I think that's going to be really important information to get in terms of being able to provide families with culturally and linguistically responsive care.
Mm-hmm. Agreed.
So, Catherine, how soon will that study or report be available? And I'm wondering if there will be any clues in that report to one of Anne's other questions about what can we do to support the teachers and providers as these kids come back into care?
I am hoping that we will have that report done by the end of May. That's our target. And yes, I think there will be some clues. In that report, we tended to focus on what would help centers to reopen and providers to come back to the field or remain in the field. So, but that is tied in with what do you need to support your children and families. And so we asked some open-ended questions about that. And I think the information from reading over quite a few of them at this point, I think that's going to provide us with some really rich information about what we need to do to support folks to be able to come back into the field and continue to maintain quality care.
Okay,
So
great.
soon.
Well, yeah, good. That's good. Thank you. May of
Sure.
2021 sounds very soon. And needless to say, the council would love to see that report when it is published.
Certainly.
So thank you. Any other questions from council members or comments? Miriam.
Thanks. I'm like, well, why not? I'm just my last meeting. I should be unplugged here, Miriam Unfiltered. I think that I just want to point out kind of a couple of things. One is that it's we've you know, I think as Beth summed up in the last quote from the parent who said, you know, this is why they took the time to sort of give this feedback. I think there's some very bold things in statements and in that research that was presented today, and I think it's you know, it's incumbent upon all of us to go back to these findings. A lot of nuggets there and really important information, and truly use it to drive decisions. I think as we think about important information, both not on just, you know, federal stimulus and what we're doing kind of in the short term, but I think all of us want to we don't just want to get back to the childcare and early learning system we had pre-COVID, but we want to get to a better one. And so there's a lot from us, you know, beyond what we had pre-COVID. And I think that there's a lot to do there, and a lot of things that maybe even challenge some of the conventional thinking that we've had for a while, and that challenge the system. So I think it's, we've got to continue, if we ask families for their voice and their perspective. I know we all agree, but you know, it's really being able to come back to that. So it's one point I wanted to make, and just give voice to that. And I think the second thing is just to say again, I think this ties back to governance. And probably I'm saying this, you know, because it is my last week. But, you know, the early learning division has a very small, very small, limited research and data capacity. It's something that we very much have to build. Remind folks that this research happens because of a federal grant. And it doesn't happen unless there's people at the division that have, you know, a vision for it to happen and resources and partner. And so it's yet another reason why we need to continue to build more capacity at the state level. We have to do, I think this is just scratching the surface, I think, of how often we need data and information like this from families and communities to be able to make decision. It's something that I know I have wanted a lot more of throughout my 4 years. And it seems like even a lot of the research that we do have is often happening. I think we're getting better at it. And this is like a really good example, but often lagged behind when we needed it to make some of the decisions. It's about evaluating decisions we've already made, right? And so there are just huge needs there. I think our governance bill and our work towards a department will help, but it's really shocking when you think about the void and dearth that we have. And we do have tremendous and incredible early childhood researchers across the state, like Beth and Catherine and others. And so, you know, it's another area where we really need to grow a lot more capacity. So I just wanted to put that out there. I think it's part of the vision in the department, but we've got a long way to go. So.
Okay. Thank you, Miriam. We will put that on our to-do list.
Thank you.
The list is growing. Well, and I want to, oh yeah, Kali, go ahead.
I just want to thank Miriam. I think it's a really important point that she makes. And I you know, have been on the council for 5 years now and have not seen a report quite like this in the time that I've been on the council. And I think I just don't want to lose it. And I mean, my wondering is, what is it that we can do as a council or council members that follow us to ensure that this is preserved, and that this exemplifies a pivot in how we collect information and what we're collecting. And I don't know the answer to that, but I think that's something we should be thinking about as a council. Thank you, Maryam. And thanks for your leadership, because this has a lot to do with your leadership, I believe.
Yeah, a lot of people at ELD, but thank you.
And I'll just comment, if I can comment on that.
Yeah.
I think the ELD in this round of data collection, our partners there, and David as well, were really intentional about making sure that we had opportunities to share the data in ways that we haven't, like with audiences that we haven't before, like you all. So I think then that takes capacity, right? It takes communications people, takes planning to make sure that the information can get out there. So I do want to recognize that as one of the things that was different this time around, I think, for us.
Yeah, thank you. Thank you, Beth. A good, insightful comment based on history, which is always informative. And Kali, just picking up on your point, and something we'll be discussing, I think, more in May, but the idea of the council doing some listening sessions, which we've all talked about, and I think your point that we can learn and be informed by these studies, as far as how the council might approach that. So we'll be working with Alyssa and David and staff and build, certainly, as we try to figure out how we can gather the information that will be most informative for us and for our legislative partners as well. So good point. All right, thank you. Council, let me just make sure that in the report that was in our packet, the COVID-19 childcare, the summary from the household survey, page 8 has a list of recommendations. None of them will be a surprise to you. They all align with Raise Up Oregon, but it's just a reminder that here's yet another collection of data that reinforces recommendations that we know we need to be advancing, and hopefully with new governance and new focus in this arena, we'll be able to move forward on those recommendations. So on behalf of the council, I want to thank you, Catherine and Beth, both for the work you do and for being such great partners with us. So thanks a lot.
Thank you. It was great.
Yeah.
A privilege to be here and happy to do it.
Yeah.
Good to see you both again. Thank you.
Likewise. Bye.
So council, we are going to take a 10-minute break. And then when we come back, we will get updates from Katie and George. And then we will go into the rest of our agenda, which we still have a lot to do. But take a break, stretch, jump up and down, do whatever you're going to do. And we'll see you in 10 minutes. Thank you.
Okay, everyone, it's your ELC administrator here to remind you that 10 minutes is unfortunately up. So if we could start returning to the computer so we can move on to the next topic, that would be great.
The surrounding landscape is just magnificent. These great big high mesa.
All right. Oh, well, what an exciting meeting so far. If we can now jump back to 2 council members and get updates from them, and then we'll go on to our next presentation. So I don't see Katie or George on video. George, are you available for an update? Okay,
I'm here. Sue.
Oh, hi, Katie. Welcome. So how about giving us an update on what is happening in Bend and Central Oregon?
They say hazard territory as of this Friday, which is a bummer for so many of us across the state. A couple of things to update you. So the Bend Lapine School District is going to begin offering in-school vaccines for 16-year-olds and above. That starts, I believe, next month. I was trying to look during the break what date. I'm not quite sure, but within the next couple of weeks in the state of Oregon, I think if you're 15 and above, you can make your own health list accepted for 16 and above. That will be a big help in the high schools, at least for those seeking a vaccination. I also testified yesterday in front of the House Rules Committee to support the House Bill, oh God, 30, what is it? Help me.
3073.
3073. 3073A
right.
Amendment 4
So,
to be
dash
precise.
4
It's
amendments,
on there.
right? Thank you, Katie.
Correct. Yeah, and it was well attended. It was good, and that was successful. We go to the next step. Ways and means. Some interesting confusion over how much it's going to cost. I think that a couple of legislators on the committee were confused that this would be an additional $700 million when it's a transfer from several agencies to one in large part. And so hopefully that'll just get figured out in ways and means going forward. But I thought it was a pretty successful hearing. As far as labor is concerned, we've talked a bit about the lack thereof in Central Oregon, those areas. Can't remember if I mentioned it in our last meeting, but there's a group of folks, including our local WorkSource state folks and community college and several others from across the region that is working on a concept of paid internships for folks in community colleges who want to maybe go into childcare early learning as a career, to actually get some funding to coordinate curriculum with paid internships to incentivize more people to take this on. And the program's being developed. They may be in front of the ELD here in the near future for some funding. There's just some T's to cross, I's to dot before we get there, but that's pretty dang exciting. And it could be a pilot project for this region that could be duplicated across the state, just to incentivize more in that labor force pipeline. And also augment current needs if you're a paid intern, to be working and helping out current providers as they try and open doors and ramp up. Bring in more kiddos after COVID. It could be really a great thing. In addition to that, so was it about a year ago? Almost a year ago, we had to shut down the effort, the pilot effort here in Central, as you recall. We raised about 140,000, 130,000 I had about 18,000 left, which I gave to the Central Oregon Early Learning Hub. They have been looking at that money and how to redistribute it. And we hired the Child Care Accelerator, which started a lot of great conversations and connections in Central Oregon that ultimately ended up with a potential pilot for micro center concept. So one coordinator that provides labor, operations, et cetera, to different locations throughout the region. Well, they're working with the hub, with a provider and the new ARPA funds that are coming in to try and do that on a really small scale with a provider who is really successful and trusted in this region to maybe supply and support a couple of other childcare provider opportunities here within the region to do a small mini micro center, if you will, to get that up and rolling. And we're thinking about using that 18K to help support that effort. Let's see, City of Bend passed a policy, I believe it was a couple months ago, about system development charges that go into any new construction, any tenant improvements, et cetera, to be permanently removing transportation system development charges that can be really hefty, like tens of thousands of dollars if you want to start a new center. So the City of Bend has permanently waived that for new child care providers in the City of Bend specifically. So those are just a few smattering things that are going on in Central Oregon as we're coming out of COVID and getting kiddos back into school and back.
Awesome. Thank you, Katie. Thanks for all the work you're doing on childcare. And thank you for testifying on behalf of the council yesterday at the Rules Committee. Appreciate that a lot. George, how about the LeGrand area?
Just a lot of things going on in LeGrand or in Union County. One thing I was going to share prior to getting off is just kind of the piggybacking on where Maryam was going with the report and the findings of the report, and whether policy or fiduciary or vision, all of those things align with that. And just like you have one-time funds with ARPA, you have one-time funds with these CARES Act, and some of those things could over a 1 year, 2 year, 3 year period be used strategically to address some of the areas that were founded by parents as a need. So that was something I was going to share before, and I just think it's important that if we look at that information and we apply resources, there are some funding mechanisms out there for us to take some action. For the school district or for LeGrand, like we've applied resources to create 4 new classrooms for early learning. So we've changed over 4 modulars that we have and converted them into early learning for early childhood special education or intervention services, as well as Union County Head Start, and creating 2 classrooms for 3 and 4 year olds. So we've been using some of our funds from Student Success Act to create 4 new classrooms. And so we're really excited about that and happy to partner with early learning agencies to do that. That's something that will be done for us in terms of moving them and transitioning them into these new spaces in July. And they've also received funds to put in, playground equipment, fencing, pavement, and to really beautify the area that we have. And so I'm excited about that. And we've been operating, so in our school district, we've been in person since January, and then starting the 4th quarter, we were under an A day, B day hybrid for grades 6 through 12 since January. But since we returned from spring break, we've been back with every student every day in our school district. So We have about 2,200 students coming to school every day within our, Ready School Safe Learner guidance. And, we're just pleased and happy to be working with our kids. Now we still have online, we still have comprehensive distance learning. We're still doing all those things, but we get to see children every day. And we're happy about that. And so sports have been going on in our school district. Tour sports have been going on throughout, all the locations around us. And again, for health and wellness and physical activity and providing a well-rounded education, that's something that has gone very well in our schools or around us. And sports seasons in our area, it's just one of the favorite things to do, I would say, for families and for kids and for our community. So that's gone well. Union County moved to lower risk. So while everybody else around us has been going up into extreme or high risk, Union County is now to its lowest stage since, I would say, since September. So we're now in the low 20s of cases in Union County per week. So we've been in that place now. And I don't know all the recipe that we're doing, but we must be doing a lot of things right.
Congratulations.
Yeah. And so again, we're just kind of in a better place with being able to operate. So that's something that's going on where there's lots of things opening, lots of things happening, at least in Union County. I can't tell you the same for Umatilla County, and I can't tell you the exact same for Baker County, but we're getting to do a lot of things in Union County. One of the things that we're working on too now is it's budget season for us. So, we're advocating to the state on the state school fund and ways and means for K-12 education, and for us, it's a $9.1 billion. I'll just call it budget that the co-chairs put out and the governor put out. And for us, we're indicating that that's, we were at $9 billion for the biennium 2 years ago. A 9.1 biennium does not cover our roll-up costs, does not take care of any cost of living increases that we have or benefit packages that we've already agreed to. And so we're indicating that it needs to be at about a 9.6. And we've also decreased in enrollment. So when you decrease in enrollment by 140 or 150 students on top of roll-up costs, you're already, for our school district, even if we recover about 60% of our students, we're still about $1.4 to $1.5 million underfunded. So even though we're getting all these CARES Act and all these funds around us that are one-time funds, the state school fund is our engine. That's the machine that gets us our resources long-term and stability-wise. And so we're going to be very strategic, of course, but in the end, we need the state school fund to be stronger. And so that's something that we're preparing, we're organizing, we're communicating, we're explaining to our staff and our teachers. And for us, though, $1.4 billion is around 16 teachers, 28 parapros, or it's at least 10 school days lost instruction. So it's a big deal. I think what I'm also doing now, or what we're, I'm on various committees as well in our state, and I work with other superintendents, but it's kind of a message of, we need to know what next year looks like. Are we returning to school? Is everybody expected to return to school? Is our normal schedule pre-COVID going to be the norm? We need to create all of our systems, and we need to know what the system is going to look like. Do we still do CDL, or do we just do online? Can we come back now into a normal schedule? How will sports look like, et cetera? Getting, I'll just say, clarity for us is important. And I also think families need to know what the expectation is. Communities need to know what the expectation is. Our unions need to know what the expectation is. And so those are things that are going on in schools to organize themselves for next school year. schools have received that 250 million summer funding as well for doing programs and services, and we're really thankful. And we're getting into K-8 enrichment, and then the high school credit recovery. And we're in LeGrand alone, we're doing about 45 different activities this summer. And just to organize that and plan that and get on the same page with teachers and parents and people on what we're going to do and how we're going to do it, it's taken a lot of time, but it's something that we've never had before. And so of course we're excited to offer more for our students and work together with our community to partner. So that's something that's going on in most school districts, I'd say in Union County, maybe across the state. I do hear at times that other districts say that their staff is fatigued. Folks are pretty tired and they don't necessarily want to do anything else. But in LeGrand, at least, we have a high level of participation. So that's that. I would say we're talking about masking a lot and the future for sports and masking and how we should do that. I'd say again, Eastern Oregon would like to have things move towards recommendations or advisory or when feasible. There's a lot of guidance that I would say in Eastern Oregon folks are pushing for, and it's kind of like, let's move towards things being recommended or advisory or when feasible. And if it's going to be required, we got to know that. But there's a lot of concern about masks in sports, and so the state's moving in a direction it feels like to allow more masks to be off. But folks that are going to do indoor sports with basketball and wrestling are still pretty concerned about, when I'm wrestling, I'm not going to be messing around with my mask when I'm shooting and for a takedown. And same thing in basketball. So there's a lot of stuff in this area that gets that kind of attention, and that's that. And I would just say again, back to that original funding comment that I made, with the report, that we're going to be in this interesting space, I think, with public education we potentially have less state school fund than we've ever had, but we have these extra targeted funds that we've never had. And there's a lot of people looking at everything and saying you're flush with money, but the reality is we have money in these targeted pots that are going to dry out, that are one time, but we don't have money in our state school fund to consistently, I'll just say, run the machine that is necessary. So there's going to be a lot of politics running their course in school districts with figuring out their budgets.
Right. Thank you, George. And that's actually a great segue into Maryam and Alyssa talking about these federal stimulus funds. And you're right. We know there are tens of millions of dollars coming into the state. And we also know they're one time. So this issues you're facing in what do you do with those one-time funds with the K-12 ongoing operations that are needed is facing early learning as well. So yes, we are all in this world together, I guess. So thank you, George, for that update, and congratulations to Union County. We wish the whole state were in that good shape. So let's move then to an update from Maryam and Alyssa on all of these federal monies that we keep hearing about and looking forward to receiving in Oregon. So I'll turn it over to you. I think Maryam's going to lead off.
Yeah, I will kick us off and then pass it over to Alyssa. Thanks, Remy. We can go to the first slide. I think as the council knows, we've had 3 different rounds of federal stimulus, and in each round we've had money specifically dedicated to childcare, and the mechanism has been CCDF, the Child Care Development Fund, of which the Early Learning Division is the lead agency. So that basically means it's coming through our budget. We're working with the governor's office and the legislature to get approval, as well as through with agency partners and stakeholders to put a spending plan together. So I wanted you just to see here, each round of this, again, there's been 3 CCDF childcare funds and CARES Act, the CRRSA, and then ARPA. We're going to spend time mostly focusing on ARPA, but I wanted you to be aware of that. You can see the amounts there. In each, the policies have evolved in each one. That I think the feds have tried to align timelines as much as possible. Some of them are specific to kind of funding type. So first, in ARPA, there was some mandatory CCDF funding. That's annual. So we'll talk a little bit more about that. So we've distinguished that in this slide. You can see we're in the still in the obligation and liquidation period for some of the CARES Act funding. Similarly, CRRSA aligned to the CARES Act funding in terms of obligation and liquidation. And then we have similar timelines from ARPA. For ARPA, we just got our notice of award, so a little over 404 million. And then we have slightly more time for some of our ARPA funds, our discretionary funds, to obligate and liquidate. And we are, which we'll talk about in a minute. I think most council members know this, but ARPA, through ARPA and child care assistance, Congress created a new sort of program, which is child care stabilization. So there's 249 million of the money that is coming to the state of Oregon is specifically for child care stabilization grants to providers. So we can go to the next slide. Given that we've had these funds come in kind of 3 different waves, I wanted you to see that has meant, we've been in various stages of putting spending plans together and have taken different components to the legislature and the governor's office for approvals. Processes have been evolving as well around these one-time funds. Again, all of these are one-time funds except for that child care, those mandatory funds that you can see there, that's 6.2 million. So that is 6.2 million annually. So a little over 12 million a biennium. That we can expect to be, a continuous reoccurring funding source. So that does have important implications as we think about activities to support that because they are ongoing. So again, we've been in different phases of, getting approval from the legislature and the governor's office on activities to support with these funds. You can see here most of the CARES Act funding has been approved by the legislature, and so that work is underway with the exception of $7.9 million. And again, we have until fiscal year 2022 to obligate those funds. We have most of the CRRSA funds either approved or awaiting approval. I would say that, and then, some of what, and as we talk about ARPA, some of what we have started with funding in these previous rounds of federal funding under CARES and CRRSA are we will need to continue with ARPA funding. So I think that's also important, not entirely, but there's some obligation to think about how do we continue to support some of what we've started with ARPA funds. And then I think you can see here again the breakdown here. So when we talk about ARPA, we talk about really 155 million in discretionary, and then we separate the child care stabilization grants and the 248.9 million, which is specifically, again, for child care stabilization grants. So we can go to the next slide.
Maryam, quick question. What does a child care stabilization grant mean? Does that mean you're sending money directly to providers?
Yeah, so I can say a little bit about some of the requirements there. So Congress has, there's some similarities really to what we've done with our emergency child care grants program. It is meant to stabilize child care businesses and the child care sector in states by helping providers cover the cost of operating during the COVID emergency or reopen during COVID. So the federal guidelines, and again, we're waiting for more official guidance, but we're looking at what was in the law. Providers are really able to cover their cost of meeting the health and safety requirements or operating during COVID. And there's a broad range of allowable costs, right? Personnel, rent, mortgage, utilities, PPE, cleaning. They call out mental health supports for children and staff. So it's really kind of largely their operating expenses. There is language that says that it is, needs to be based on providers' operating expenses. So, we are, again, awaiting kind of more official guidance from HHS, but sorry, I'm having a little bit of computer issues here. Hopefully you guys can still hear me and see me okay. But that's, yes, it is largely about, continuing to support our childcare programs and providers.
Okay, thanks.
Katie's, we do have 10% of the funds are can be set aside for administration of that to 48.9 million. So we can look at helping with technical assistance to apply for the funds. There's also an allowable use of that administrative set aside is supply building. I see Katie asked a question. We cannot use it to support capital projects. There's a prohibition against that within CCDF, but we will talk about, Alyssa will talk about in a minute, other ARPA funds that are non-CCDF can be used for capital projects, the state and local recovery funds. So there has been a request made to the governor, I know, about using some other ARPA funds for childcare facilities. Hopefully that answered your question, Katie. So again, so we have been we have worked on some preliminary stakeholder engagement around ARPA priorities. So what you're seeing here are kind of activities in very broad categories. This doesn't account for sort of all of the ARPA funds down to the penny or dollar or million even dollars. But I think we're starting to, I think, create some really broad categories that have emerged in as priorities. I think there is still much work to do to define these, get to the how, the what, the who, when, even within many of these categories. And again, some of this is really also some of these activities are really defined on commitments that were started in the previous rounds that will continue. So I'll say on a couple of these, and then I'm going to hand it off to Alyssa, particularly the ones that I think are much more still open-ended, and I think will require a lot more work with partners to give shape to and better define, and I think make more concrete in the coming weeks and months. You'll see here really the biggest I think expense that we have but sort of biggest ticket item coming out of ARPA is going to be the state's commitment to copay reform and a shift in copay policy for the state. So I think, as the council knows, we have been operating under with zero copays now for over a year through the duration of the emergency. We're using funding to be able to continue that. We anticipate we will be needing to transition from zero copays. That is tied to the state of the emergency, and we do not want to go back to the highest copays and some of the highest copays in the nation for families. We've heard that's a priority for partners. That's a priority for both ODHS and ELD and other agencies. So that is going to be, we're proposing to use ARPA funds to be able to cover the cost, even though this is one-time funds, to be able to cover the cost of a new copay policy for the next 2 biennia. High needs rate would be able to provide an enhanced rate for children with special needs, healthcare needs, or developmental needs in the ERDC program. That has emerged as a huge priority, an important priority. We're working with ODHS on that. That would come out of mandatory. In the summer learning proposal, we propose to increase ERDC. We see the caseloads trending in that direction. We think with copay reform, it is likely that we will continue to see more families finding out about the program. We have more work to do, and that is being planned as well to increase our activities around outreach, particularly outreach to immigrant families, BIPOC families and communities, including partnerships with culturally specific organizations. A lot of exciting work ahead, more outreach to providers to try to get them, to participate for those that aren't participating in ERDC. So for a lot of different reasons, we anticipate caseloads could be increasing. So we've proposed to be able to cover some of those costs with ARPA funds. We've talked about, again, I've talked about the childcare stabilization. There's still a lot of work to do to shape that. Again, broad allowable uses, as I talked about before. A lot of has emerged about being able to do something on compensation within childcare stabilization and wages for staff. So I think that will be some work to look at as we get more guidance and work on that. I mentioned earlier in my update, ECC 5. So we're seeing this ECC 5 would sort of be the phase out of that program, and we think a bridge to hopefully being able to transition to these childcare stabilization grants. And with that, I will kick it over to Alyssa to talk about, and Alyssa, I'm happy to talk about any of these other ones, but again, I think a number of these still need a lot more in terms of engagement, and I know that's work that you will be leading, and so I'll kick it over to you.
Thanks, Maryam. Yeah, so we've started doing some very preliminary engagement. As you all know, the legislature has been convening special hearings, I should say, to hear from partners and community members about the state level ARPA funds, the $2.6 billion that's coming to the state for further distribution. And so in anticipation of those hearings, our office, the governor's office, had worked to convene partners. We had 2 sessions with partners to kind of walk through at a high level what these funding uses could be. And we walked through this table that Maryam shared with you all to kind of think through what are the elements of technical assistance, workforce supports that we should be thinking about. And so I think that those, as Maryam said, are going to be the areas where we need to really continue to work together and understand what's needed on the ground, what do providers, what do families need, so that we can really be bolstering our childcare system to be able to come out of COVID and be able to take on more children safely, build our supply back to what it was and beyond. So I'll focus mostly on the governance, infrastructure, and the facilities portion. So we have set aside $21 million in governance and infrastructure. The idea here is that these funds would be necessary with the passage of House Bill 3073 and the creation of the Department of Early Learning and Care to help us buy one-time things like a provider payment system to take over ERDC subsidy, to create a multi-purpose search tool so that families are much more easily able to find available childcare in their area, be able to see quality ratings, see who's able to serve or is part of the Inclusive Childcare Partners program, and kind of work on that greater integration that we know families have been asking for a while. There also could be some funds used to help with some limited duration positions, Obviously, moving the division to a department has many facets to it. There's a lot of just administrative functions that the Department of Education has been providing that would need to be taken over. So we may be able to leverage some resources there. On the facilities portion, Katie, it was a really great question. So as Maryam mentioned, the CCDF ARPA funds cannot be used for capital projects. However, the governor has been working to see if we could set aside a portion of that $26 billion that's coming to the state to direct a portion of those resources to investments in facilities and infrastructure, whether that's bringing existing facilities up to code, making sure that they can continue to comply with licensing requirements, or to assist in new facilities coming online as we continue to grow supply. This 25 million number is what the Early Learning Division proposed to the governor's office. We're continuing to work with the legislature on kind of scale and scope. But we've heard from partners in childcare, as well as some of our partners in workforce, economic development, housing, just the need to have this investment with facilities, both from a co-location perspective, as Chelsea shared at the beginning of our meeting, and from just a childcare facility perspective. So I'll stop there. I know it's a very high level, and happy to answer any questions. I think our hope is we'll continue to work with partners to really parse out what each of these pieces could look like. I think the governance and infrastructure bucket will probably look the most amorphous for the longest, especially while we await the passage of House Bill 3073 and we prepare for the September 2021 legislative report that's required and would really get into the details of what standing up this agency would require. But the technical assistance and the workforce will be the areas that we continue to work with partners on kind of shaping how those resources should be used and deployed.
So Alyssa, just tell us if you would, does this end up being a Ways and Means decision? Or where's the decision making actually happen about this allocation of funding?
It's a great question, and it's a little undecided. So we are not used to getting money from the federal government that's unanticipated, right? So we've had to kind of create new structures over the last year for every round of federal assistance we've gotten, and it's looked different every time. So we are, especially while the legislature is in session, want to be partnering with Ways and Means and other legislators to make sure that they understand the plans for these funds. And the question of formal approval is one that isn't completely landed. I think the other question too, as you saw in the earlier slide with the CRRSA dollars, there might be a portion that's approved while we continue to finesse. And so we might be able to get sign off on the child care stabilization grants, which are fairly clear cut. We may have to continue working on other funds that would not be finalized till after the legislature is done meeting. So there's still some unknowns at that level.
Okay, not surprised, I guess. Unusual times. Council members, questions for Alyssa and or Maryam? Obviously, we are going to be hearing more about these funds in the weeks and months ahead, and we can get another update at our May meeting.
I have a question regarding engagement. This has come up in the K-12 fund bucket. There's a lot of folks on the ground that feel like families and communities should have some input on distribution of dollars. And I would say the same is true in the early learning space. So my wondering is, how are we engaging community? It occurs to me with the Early Childhood Equity Fund, you have a lot of people receiving dollars that are serving diverse communities that maybe they can provide some input since there's already a contractual relationship of some sort with those entities and they're statewide. I think thinking creatively about input will be important, and figuring out what people need, what communities need is important, because I imagine it'll look different depending on the community too. So a lot of these are system level inputs, which it makes sense, and that's just another thought in my head.
Holly, I think it's a great suggestion to look at who we can easily bring to the table with existing relationships. And these funds are difficult since they're intended to focus on childcare providers and our childcare system. But I think you're absolutely right. We need to make sure that families have an opportunity to say what they want to see from the system as well. Thank you for that.
Hey, this is Angie. I just wanted to comment that I was happy to see the provisions in there for apprenticeship opportunities, because increasing the workforce is becoming really important with the expansion we had this year and possible expansion. You know, it's getting harder and harder to fill positions with qualified teachers because everybody needs them and wants them. So I appreciate the alternative approach and using apprenticeships as well.
Thanks, Angie. That's great to hear.
Other comments or questions from council members? Okay, if not, thank you, Alyssa. We will look forward to more of these conversations with you in the weeks ahead. It
So
is.
the only comment I would make is I never thought I'd see the day. I never thought I'd see this day.
It is hard to believe.
Yep.
It'll be fun to listen to the State of the Union tonight, because I'm guessing we're going to have some comments about early learning and get a glimpse at what Miriam's new life is going to be like. I bet she'll be listening. Right.
Can I ask one other question?
Sure. Yeah, go ahead, Kelly.
Is there intentionality around CCNRs? Like, for a long time, we've been talking about how they lack the capacity and are woefully underfunded. And I'm wondering if there's any plan for an infusion of dollars to the CCNRs to help support some of the TA and other things.
Great question. Is that an Alyssa or Miriam answer?
A little bit of both, I would say. We can tag team on that one, Alyssa. Yeah, absolutely. You know, I think we have been, I appreciate the question so much, Kali. We have been, I think, slowly kind of chipping away at that. All of our CCRNRs now have an infant and toddler specialist. As you know, we've been able to add 2 regions, you know, to build more capacity in Eastern Oregon with our RNRs, more quality improvement specialists. I think most definitely with some of the technical assistance supports, we will be able to do that. I think with also with SSA, I mean, I think the field, I think in some of our workforce initiatives, you know, that money in SSA has yet to be realized in communities yet around our workforce. So Angie was talking about, you know, apprenticeships, and so some of the way I've been thinking about some of the workforce money is like, in ARPA is, you know, what are we doing kind of short and near term? And a lot of what we're thinking about in SSA is really, and even some of our projects in PDG that haven't, you know, have really been impacted and delayed by COVID is some of the reimagining of our system and building that. And I think a big part of that is also, you know, capacity of our RNRs, more consortia and partnerships, building more capacity in higher ed. You know, in the higher ed system, apprenticeships. So it's going to be really exciting. I think there's a lot. So we, you know, we have a long way to go. But, you know, I think both in the short term and building on what we've done and SSA, I think there's a lot of opportunity.
Thank you, Miriam. All right, thanks, Council, for the questions and comments. Exciting times, as Peter said. Some of us didn't think we'd live long enough to see this, so it's quite exciting. All right, let's move on then, since we've been talking about CCDF for quite a while now. As you know from the agenda and council members from some of our earlier phone calls, Part of our responsibility as the council is to review and provide input on the CCDF plan, which is a federal requirement in order to get tens of millions of dollars from the feds for childcare. So very important responsibility we have, and one that frankly I don't think we've spent a lot of time on in the past. So if there's ever a good year to be looking at how to make sure we're using our childcare funds well, this is obviously the year. And I want to, you all know Harriet Dichter because she's been with us for a long time from Build, thank goodness. And we all love David Mandel, who has been with us for a while as well. But I want to thank both Harriet and David for the grid that is in our agenda that provides an incredible outline for the CCDF plan. And as you know from looking at it, it aligns what are the feds requiring, how does it relate to Raise Up Oregon, and how does it relate to pre-established council priorities. And then very importantly, it suggests what could be improved in the draft plan. And the draft plan is the draft, so we can modify it, but it's a statement of what exists. It's not visionary. So David and Harriet will explain how we can have some vision ourselves, even though the feds aren't asking for it. But exciting times and perfect timing to be looking at this plan. So I'll turn it over to the Harriet and David show.
Thank you, Sue. Thank you, everyone. I think Remy's going to put up our PowerPoint. And as she's doing this, I'm going to start, let's go to the next slide. So Maryam and Alyssa were just talking about the federal relief funds. And those are, for the most part, CCDF funds. And eventually this plan we're talking about is actually going to have to be amended to reflect the final decisions of the state. Just so people know. So there is a relationship between what's in this plan now and what's being discussed and considered in terms of the future expenditures. So we today are really going to focus on trying to do two things, basically, hopefully pretty rapidly, because I know everybody's been meeting for a long time. The one is to kind of orient basically to the plan. And the second is to prepare for our May discussion. So Remy, if we could go to the next slide. So one of the things that's really interesting and important in actually the CCDF, and Kali, you even just raised this again in terms of the ARPA outreach and stakeholder engagement, is unusual for many federal laws. CCDF actually requires that the state have stakeholder review and some level of stakeholder engagement, basically in the plan development. And sometimes states see this more as a surface requirement rather than a deeper requirement, but there is an opportunity to really build your state childcare policy, right, from a really engaged process. So for the council's purposes, there's also a nice opportunity because of the connection and the ways that Raise Up Oregon has been driving so much work and thinking for everyone to make sure there's continued to be alignment between the CCDF plan and the values and propositions basically that are put forward in Raise Up Oregon and CCDF. The last purpose really of the engagement is actually futuristic. And that does relate, I think, also to the conversation you just started to have where Maryam and Alyssa were sort of outlining stakeholder engagement to date and potential buckets around the ARPA funding and really the other unresolved yet still to be spent federal relief funds. So there are some opportunities basically in the engagement that hopefully can affect future allocations and future policy for the resources. So those are kinds of reasons to engage. I think we're not trying to get overly involved with the fact that there is a requirement for engagement. I think that's actually a good thing. I wish actually more of the federal laws around, our various programs had these sorts of requirements. It's more extensive in CCDF than in many other things. If we could go to the next slide.
And Harriet, I just want to add, and we'll come back to this more as Harriet said, I think we have an opportunity to assist in setting future direction about the federal child care funds and the child care system in Oregon. The federal state plan template provides little opportunity to really talk about what those forward-looking goals are for a state. So I think one of the things that we're intending to do with your input and the input that we're getting from other stakeholders is to produce a companion document to go along with the formal state plan that is a little bit more forward-looking and captures what we're hearing.
And we're hopeful that when Maryam goes to Washington, Maryam, you can have a conversation with Katie about amending the preprint to have a future section, because Oregon isn't the only state complaining about this. So let's take a minute to look at what is the purpose of, we've used the acronym here, CCDF, Child Care and Development Fund. And we're going to review this because historically, people have tended to associate childcare only with this work support element. And actually the law has multiple purposes. And those purposes speak to the continuum, basically, of supports and services needed to be able to build an effective childcare system. So the law is intended to really have a focus on children's healthy development and school success, and at the same time to be essential as an economic development or work support tool. So there are two dual purposes: children in the context of their families, and families in the context of their ability to participate in work, okay, or in training and education. There are a set of very specific purposes that are outlined. And these purposes include, because this is originally a block grant, to allow states maximum flexibility so that states are decision makers around programs and policies that are meaningful within that state and the state's communities. And you'll see that while there are parts of this work that are somewhat rigid, there is a lot of flexibility here, and there's a lot of opportunity for states to make decisions. What is best for children, families, the economy, childcare providers, et cetera, within their states. The second core underlying purpose, basically for CCDF, is to promote parental choice, okay? And so what that tends to mean, in terms I think that we tend to talk about it more, is mixed delivery, a variety of places basically where parents would be able to make decisions about where they'd like their children to be. So home-based services, center-based services in the for-profit sector, in the nonprofit sector, et cetera. The idea here is this: a lot of these resources go to services for very young children, and there's a lot here around respecting and honoring parents' decisions about where they would like their children to be, and to be able to exercise choice, not have just a single solution in terms of their childcare options. Third, and connected to this, is there is an encouragement for states to do the state's part in helping to provide information to families so that they know what their options are, and that families basically aren't just guessing, but really can get some guidance and have good opportunities. And I think here that's exemplified from some of the work that's gone on, especially with your 211 system, and some of the work that actually Kali just raised around your resource and referral agencies and some other innovations in the state. Let's go to the next slide. Another purpose of this is really systemic, okay? And so this fourth purpose talks about high quality coordinated early childhood care and education services. That's a systems focus. And also, again, re-emphasizes options for parents, and also emphasizes a focus basically on people who are lower income. Fifth purpose here is a quality purpose. And that is to say that there is a need, as we've all talked about for a long time, over overall improvement in quality. And those pieces are basically addressed through some mandates, actually, that you'll see in the law around health and safety, but also around opportunities around professional learning and the workforce. The sixth purpose is reiterative of that main purpose that I said, which is improvements for children. I'll focus on the bottom line here. What is the experience for children that is really good for them and promoting their healthy development? And then the seventh purpose here is really around increasing, scaling, basically, especially with a focus on low-income children, the number of percentage of children who are in high quality. So this is an important commitment. This is really an understanding, which I think you all have talked a lot about in terms of the council, that the services need to be meaningful to support the good development of children. And there is a focus here on doing more and doing better for children. So that takes us through the purpose. Let's get to the next slide. David is going to address some of the budget slides in terms of some of these system structures that influence fund allocation.
So along with the other regulations, the Child Care Development Fund comes with a set of basically requirements for states around spending and allocation. I'll say in some sense, this is a little bit of a simplification because of course with federal rules, they end up actually being much more complicated. But I think at the highest level, I think this gives a sense of the direction to states in terms of the use of the funds. And the biggest direction is that a minimum of 70% of the funds need to be used for direct services. And what that means in this context is direct payments to support families in paying for early care and education. So if you think about employment-related daycare and baby promise, those are the kinds of direct services that a minimum of 70% of these funds need to go to. There's also a quality activity set aside, and that's a minimum of 9%. Quality activities is defined quite broadly, so that includes both supports for the workforce, supports for program improvement, and it also includes the state's basic health and safety structure. So licensing and monitoring and background checks are also included in the quality activities. And then there's also, I think, a really important set aside to make sure that infants and toddlers are prioritized in the use of resources, and there's a minimum set aside of 3%. So in Oregon, that includes QRS supports for the infants and toddlers, the infants and toddler specialist, work on safe sleep practices. And then while the rest of these were minimums for child care administration, there's a 5% cap. So that includes currently the indirect that goes to the Oregon Department of Education, the work for state plan development, resolution of audits, salaries for administrative functions, et cetera. Can we go to the next slide? So what does this sort of translate in terms of what this means in Oregon? So we receive about $214 million in CCDF funds every biennium, and 123 million of those currently go to direct services. So most of that is the transfer that the Early Learning Division makes to the Oregon Department of Human Services for employment-related daycare. And to give you just a little bit of a sense of scale, the state puts in about 66.5 million in general fund to employment-related daycare, and then so there's about 120 million federal funds. So two out of every $3 approximately for childcare subsidies in the state are coming from the child care development funds. I think it gives you a sense of the significance of scale. And I know earlier in the conversation, funding for child care resource and referral agencies, and that would be included in the 70.9 of quality activities. Up until recently, basically our R&Rs were basically exclusively funded out of the Child Care Development Fund, but I think it still remains the case that without the Child Care without the CCDF funding, we would have no child care resource and referral agencies in our state. Next slide.
Okay, I am going to try to help us understand a little bit about what is the plan. And this is important because I think often, especially because of the way the council has worked on Raise Up Oregon and on your definition of priorities and the forward thinking work, that we think a plan might be like a strategic plan where we have aspirational aspects. But here's what we wanted to help orient people to. So as you're reading and we're getting into this, we really understand, what does this plan document really represent? So it actually serves as effectively the state's application to draw down the federal child care funding. And in that regard, then, it is a statement of what the state is doing, reflecting approved policy, not a statement of intention. So this particular plan that's being reviewed will go into effect with the new federal fiscal year on October 1st. And it is to represent what the state is willing to be accountable for doing, basically, starting in the October 1st period. To that end, it is actually used by the federal government for compliance and monitoring purposes. And the federal government monitors whether Oregon is implementing what it put into the plan. And it's also checking all of the plans to make sure that they meet threshold, statutory or regulatory requirements from the federal government. So I think this part is pretty important because the states in some levels, I think, often feel constrained when they're writing the plan because what you're writing down is what you intend to do. And the reality is that the federal government has actually picked up its oversight and monitoring over the past several years. There's more extensive oversight, more extensive monitoring now than there used to be. So in that regard, you'll also see, for those of you who maybe looked ahead at the plan already, that there are like a lot of places in the plan where you're checking boxes off or you're being asked very specific questions. Those details tend to reflect where there is specificity in the federal statutory and regulatory requirements. So you may be asking, why are we drilling down in a particular manner when you're looking at it? And where there is drilled down, it generally reflects, an amendment actually, to the federal law made in 2014. Now, a really great thing about the plan is CCDF, more so maybe than many other authorizing laws at the federal level, does take a systems approach. And it is comprehensive insofar as most core elements or aspects of the state's work in childcare are addressed. And you will see that when we go through the plan elements, but this is really generally considered an asset, that there is an understanding that childcare systems and services are pretty complex. And so there is a request, basically a requirement in developing the plan to try to address basically some of that complexity that is needed. The last thing we do want to say, and you'll see a little bit more in some of the details, is one of the good news is for Oregon is that there is good alignment basically between the CCDF plan and Raise Up Oregon, and that was deliberate to try to get these things to go together. And people actually just want people to share, like, have a lot of respect for the role Raise Up Oregon has been playing for Oregon, and the fact that those in the know understand that the child care plan in CCDF is not so visionary, but that you have a strategy basically document in Raise Up Oregon to help with guidance. So let's go to the next slide. So some of the things that we're going to talk about are kind of the negative, like what might be things you would think would be in this document that you are not going to find there. So one of the most interesting aspects of the plan is that it's not a budget. And in that regard, this part, as people know, does bother me about it. It does not require the state to discuss the reach or the scaling of the system. So when you're reading it, you will be reading about an initiative, but you won't necessarily be able to tell how much of the need are we meeting with this initiative. So how many children and families would be qualifying for services? How are we getting, how many are we going to get to? How are we doing in terms of scaling on quality? So that's an interesting aspect of the plan, is it's reciting, these are the programs, policies, and initiatives we're going to implement, but it's not a requirement to show your fund allocation basically within that, and it does not ask you to indicate, again, reach or scaling. There are some new things that the federal government has been introducing more on the quality side, where they are starting to ask states for a little more performance accountability, but it's pretty gentle still in terms of the overall endpoint around reach or scaling. And then finally, I think we've all, Sue said this already, David said it, I've said it. Okay, the plan is representing the current commitment, basically, of what the state is planning to do. It is not representing an idea that's in discussion that's going to be further explored. So those are some parameters to try to think about, basically, as everyone's going through and taking a look at least at one section of the plan and possibly at other sections of the plan. Let's go to the next slide. David, I think, you're going to do this one, right?
Actually, I think this was you, and then I take the
Okay.
next slide.
All right, fine. I wasn't able to successfully print out the notes. So this part is, remember when I said the plan is systemic? It's got a systems framework in it. And so for purposes of how the federal government took what was in the law and regulations and then translated them into this application, these are the sections basically that they came up with. And I think you will see that they actually do speak to, right, a lot of the systems elements that we know are really important in terms of trying to create a system. The one that is subsumed in here, and I have to say this, Katie, I hope you're still listening, is supply is actually also included, even though you don't see it on its face as a systems element. So I do want you to know that that is in here. But the plan elements sort of speak to issues of leadership and coordination. And again, this law, perhaps more than many that we see at the federal level, does promote the idea that you're actually supposed to talk to others who provide adjacent services and work in cooperation with others. And so that's a positive, basically, within this. The pieces we've talked about here are outreach, consumer education as a plan element. Very important. Sections 3 and 4 are really around how are we meeting the needs of families? What is the approach? Essentially to be able to subsidize basically services for families or to pay for tuition. And then equal access is also concerned, as well as the section on financial assistance, is what are our rate structures? Basically, how are we approaching things like supply building? So these things together basically are going to help us with this sort of overall mega view of things that are connected and currently primarily in Oregon to ERDC and Baby Promise, and have potential actually for additional revisions. There's a very significant section on health and safety. When the federal law was amended in 2014, there were a lot more particulars added about health and safety. So there's a pretty heavy drill down on health and safety in the plan. And then really important, sections 6 and 7 really speak to some of the core issues about quality. Who are the people who are working in the field? How are they being supported and nurtured and respected, basically, to be able to do their work? And then section 7 really is, what are the state's policies and efforts to try to assure high quality, culturally responsive, linguistically responsive programming? Those are covered in section 7. The last section actually is a very technical section, and we're not going to go over it so much in terms of the next meeting, but these are accountability provisions that really have to do with grantee integrity. And so those pieces are pretty critical. And they reflect a lot of the back and forth in terms of the state and what the feds will be looking at to assure that they're public taxpayer dollars and that there's good accountability for how they're spent. So those are the core elements basically for the plan. Now I think I'm turning it over to David.
Thank you, Harriet. Harriet and I have been working really closely with Sue to develop a plan for the May 12th council meeting. So given everything that Harriet has told you about the plan, it's 215 pages, it's level in the weeds. How do we make a really meaningful, make your time in May as meaningful and as impactful as possible? So I think, one of the things that I mentioned is that we are also planning on putting together a forward-looking document based on the input. So, if, to really help think about that way to leverage the feedback. So at the May meeting, I think the plan is to work in small breakout groups to explore key elements of the plan. And as I said, we've been working really closely with Sue to develop the grid that was in the meeting packet today to provide that alignment with the priorities that you identified at your retreat in the fall, but also went back through the Raise Up Oregon Progress Report to capture some of the key work that's happened in the last 2 years aligned with the plan. And then Sue also wanted to make sure that there was things on the table to help spark the discussion at the next council meeting. So we went through, in addition to the ELC priorities, the recommendations from the Child Care Task Force report, and then as well as some input from other stakeholders and partners. So I think the goal is to really use that as a jump off point for the discussion. Sorry, Rem, you can go to the next slide. So this just to give you a little overview of the CCDF plan guide, and we're covering the 7 sections in that. We didn't cover the section 8 on accountability. Each section includes the following information. So big thank you to Harriet. So you'll see a summary of what are some of the key elements that are covered in that section plan. So I know sometimes the title, equal access, what does that mean, doesn't really tell you what's in that section of the plan. So Harriet provides some additional details to help you understand what's in each of the sections. Again, the summary from the Raise Up Oregon Progress Report, those ELC priorities, and then some other ideas for potential, for other ideas that have come up from the task force or from other stakeholder engagement of potential ideas for improvement. And then finally, some discussion questions for your breakout groups. Next slide. So again, as you go through the grid, you'll see under each section, future opportunities. Again, with the task force recommendations and some ideas pulled from potential areas for improvement from stakeholders. When you have your breakout groups, these are just meant as conversation starters. So as we'll go to the next slide, you'll see that the 2 questions you'll be asked are, do you have other ideas for improvement beyond what's either in the task force or what's listed in that next cell? And then thinking about these ideas for improvement, what should be priorities moving forward? So finally, last slide, please. So given how long the ELC, given how long the plan is, I think we thought it was not reasonable to expect each of you to read all 215 pages of the draft plan. But we are hoping that each of you will be able to review at least one section of the plan, and with the eye of sort of thinking about those questions and some of those ideas for improvement. I think that's both because taking a look at one of the sections of the plan, I think is one way to actually understand what the plan really means for the state, but also just as an opportunity for each of you to be a conversation sparker in your breakout group. So I think the idea is if you could take a look at those section and have that grid, sort of think about priorities of the council and some of those ideas for improvement. And then again, we'll be meeting in those breakout sessions to have those discussions. And then we'll also, if folks are interested between now and May 12th, wanted to have some deeper conversations with Harriet, myself, or some ELD staff to better understand what's in those sections. We'll make ourselves available for that as well.
All right. Thank you, David and Harriet, for that overview. And council members, we all have talked about this in our conversations over the last week. So I want to thank you all for being willing to take a section. And in the email I sent out, I think on Monday, maybe, I suggested sections for each of you to read. I haven't had anybody respond yet saying not a chance in the world. So I'm assuming no news is good news. But if you would like to have a session, a 30-minute session with Harriet, David, or the appropriate staff member about the section I've asked you to read, just email me back, let me know, and we'll get those sessions set up with staff before the meeting. So thank you, David and Harriet. You are wonderful. Great update.
So I noticed on the list that you sent out in the email that Peg and I are doing health and safety section. So were you envisioning that we would do the whole section together, or that we would split it up and each do half of that section?
Good question. I don't know, Harriet, do you have a thought about that?
In that section, Angie, if you look, that one's pretty long. That's one of the ones with a lot of the checklists in it that I talked about. So if the two of you prefer to split it in half, I can go through and try to make a demarcation for you if that's easier for you. So I think it would say it's totally up to you. If you want to do it that way, I can try to look and kind of figure out like an easier stopping and beginning point.
I don't know that's necessary. I don't know if Peg's on right now, but I can email her and we can decide. I'm fine doing the whole section.
That would be great. That's a pretty technical section.
Yes.
Thank you, Angie.
You're welcome.
And Peg, wherever you might be. Okay,
So if I
Katie.
could,
Yes.
So I'm really sorry. I cannot be here on May 12th. And so I'll take section 4 and take a look at it. If anybody wants to partner with me, that's great. I definitely would like to meet with some staff just to go over it, and I could write my thoughts down and send it back to you, and you can go from there. But I apologize. I've got a family commitment that day.
Those happen, Katie, no problem. So thank you for being willing to do that in advance. And somebody, Harriet, David, someone will be in touch with you about that. So thanks. Any other comments about the plan or your requested involvement in the plan discussion? Okay. If not, then let's move on to the last part of our agenda, which is to say once again, a tremendous thank you to our fearless leader, Maryam Calderon. I think we all know we wouldn't be here in Oregon at this pivotal point without the leadership you've provided over the last 4 years, Maryam. So we all are indebted to you, but so are the children and families of Oregon. There's no doubt about that. So let me open it up to other council members who may want to make some comments, and then we might even give Maryam a chance to say a few parting words now that you've got free reign to say anything you want to say. Tell us what we ought to be doing for the next few years.
Well, go ahead, Peter.
Go ahead, you go ahead. I'll follow.
No, I just want to say, Maryam, it's I'm sort of a newcomer to Oregon. I've only been here for 8 years, but to see someone who is such a professional, who brings such deep expertise in a field and to walk in the door and to take leadership in a very complicated time, where actually what was nice was there was political will. There was political will here, but that didn't necessarily mean it was going to translate into something that that was an actionable plan for us. And so you walked in and you said, okay, this is the way that these are the principles and the values that are going to guide us, and I'm going to make this happen. And you did. So it's pretty darn cool that somebody could do that in a major state system. And so we know that you will take that experience and you will take it to the federal level, and you will know how hard it is to move things at a state level when you go to the federal level, even when you have the political will that you have with that leadership, because it's not just about the political will, it's about all of the systems that can make it happen. And we're so glad that we gave you a test ground, and that we made you a trial by fire, and we made you figure it out at the state level, and hopefully you can do that at the federal level, because it's whatever you do at the federal level we can be magnanimous, and we can be magnanimous about our gift of Maryam Calderon to the state, and say that we can put up with our laws. We know you will take care of us. But I hope that the experience that you've had of figuring out how to make it work at a state level is what you take with you to try and figure out how to make something at the federal level work for everybody. And we know we won't lose you. We know you will keep an eye out for us. We know you will take that experience and make it work for kids and families everywhere, particularly the most disadvantaged. It's been an honor to know you, and we wish you the best success. Over to you, Anne.
Thank you.
Peter.
Well, I think Anne speaks for us. Maryam, I'm curious, what will you be doing? What's like your focus when you join the Biden administration? What are they going to let you do?
Yeah, well, they haven't announced it officially yet, but I start Monday, so and wrap up Friday, so no rest for the weary here. Get the weekend. So I am going to I'm going to the Department of Education to advise on early learning and be interdepartmental liaison. So I'll get to work on governance at the federal level. So I will get to work on, we're going to hear tonight, as Sue said, the amazing, bold agenda around pre-K and childcare. There's a lot there too, I think, around the workforce, community colleges, so yeah, it's I think when I really felt like it was very hard to make this decision because of all the incredible work. I had FOMO, I fear of missing out. I don't want to leave Oregon. We have so much going on here. But I think I really felt, I think the call to serve, and I understood that this might be a really, really unique moment to make some change to the federal early childhood programs that have such an impact on states, systems, and community systems. As Anne said, I've learned so much here. And I felt like I wanted to contribute, so.
Nice. I like Anne's framing that Oregon is your boot camp. Kind of like that idea. Yeah.
Yeah.
Comments from other council members?
Go fix it, Maryam.
Will do.
Send some money back for facilities, right?
Yes.
Just truckloads can come
Katie's
in.
going to be the first call.
I might be the oldest person on our screen here, and so one of the things that in my old age that I'm very convinced about, it's not the what. We know what kids need to succeed. We have decades of social science research. We have biological research on brain development. We have best practices. it's not the what, it's the how. How on earth do we do this? When we have the realities of low capacity, when we have the realities of political divisions, when we have the realities of not enough workforce, et cetera, et cetera. And usually I would say in that, and when we have the realities of not public will. But that one we got right now.
Mm-hmm.
So we got to like swoop in and figure out the realities of the how, given that we have public will right now. It's going to be a precious little moment and we got to make it happen. So we need you, Maryam.
And I think that's exactly why Maryam made this decision in my conversations with her. So Maryam, we will give you the floor.
Okay. Whew. All right. Try not to cry again. I've been thinking about what to say. At first, I want to say thank you. What an incredible, I think I'm just in awe and continue to be inspired by, your leadership, your vision, what you do for your communities, what you do for our state and our system, your support of me. I think I said in my note to you all, Sue has been there through some really, really difficult times. There were definitely moments like, oh my God, what did I get myself into early on? So, even from when you were all called and asked to serve by the governor, just thank you for saying yes. And thank you all so much for taking this on. I know you all have very important, busy roles in your communities and in your work. So thank you for your service. Thank you for all you do for our community, our children and families, how you support the ELD, how you support all of our agencies. So thank you. I wanted to share some things I've been reflecting on. So I, when I was thinking about whether to take this role, and I don't just say this, but I really, I've done this in every role, thought about this a lot with the new next opportunity, did this a lot before coming to Oregon was, well, am I the right person at the right time? Because I think this is a lot about, right person, right time. And, what is really needed. I had admired a lot of the work that Oregon had done to build the council, to build the division, to build the hub system. And, will I be able to contribute? Am I the right person at the right time? And I kept hearing over and over and over again from many different partners, stakeholders, inside government, outside government, in philanthropy, in the public sector, in the communities, vision, we need vision. And it was so consistent. And I was like, okay, well, I can do that. I'm good at that. But then I kept hearing it so much, I started to get worried. I'm like, well, do they think there's this like one person that has the answer? Because I'm not that person. And, if there were a playbook on early childhood systems, I would be convincing that person to come take the Oregon job, if somebody knew how to do it already. But I thought I can really listen, and I can, Oregon has a lot of, is a very innovative state. And I know there's a lot of really good work, and there's a lot of stuff to build on. And so we'll put a vision, I'll help put that vision together. So I guess I offer that to say, it's really been about all of us, I think, as you said, and political will. I mean, I've had a tremendous fortune to have Governor Brown, who has supported this work, and had many times been, the driving force to say, no, this has to happen. This will get done. I'm eternally grateful to her for that. Credible legislators, including some amazing champions. I mean, I've had some conversations in the last year and even in the last couple of months in this governance bill with some legislators to say, you are the, you're the change we've been waiting for on some of these issues, really stepping up and speaking out. So, this council, community, advocates, providers, families. So it's, I think it's all our vision. So I say thank you to that. Some of you may not know that I actually, I think I've shared, usually when I'm in DC, I'm trying to figure out how to get to Oregon. And then when I'm in Oregon, I'm homesick for DC. So that's just, what, what is my reality and my family's reality. Actually was contacted by the Kitzhaber administration to right before they were thinking about the first early learning system director. Share that with ELD staff. So I feel like maybe it was in the cards at some point. I was supposed to come here. I think I came at the right time when I was meant to. I didn't come that time. My children were just starting kindergarten, and we had just won the immersion lottery. So they were going into a bilingual ed program, and there was no way I was gonna leave that for my twins. And I thought, I'm not gonna get 2 spots. So anyway, I think, it worked out, and it came when I was supposed to. And I feel like I just feel a tremendous amount of gratitude for being able to contribute what I did. As usual, I have a list of things. I can't believe if you would have told me before I started that there would be things that I didn't get to do or get over the finish line, I would have said, there's no way, you don't know me. Definitely going to work on that. That's a top priority. And it didn't get to, and that's always true. And then there are other things that, became really important priorities that I didn't know were going to be. But I think, you contribute, you listen, you build relationships, you try to leave it stronger than you found it. And I'm so proud of all the work we've been able to do together. I ultimately said yes because I felt about this new opportunity because I've learned so much. I've had so much of what I thought I knew reinforced or confirmed. I think I'm ready to go keep working at this. And I think there's a really unique moment to make a difference. And I know that I'm going to carry all of the lessons I've learned. I came to Oregon right after undergrad, very early in my career, and Oregon gave me some leadership opportunities that were like, I don't think I would have been able to do some of the stuff that I did if I hadn't gotten those. And I feel like Oregon did that again. So very appreciative of that. So I will miss you all. I'll send you my new email. I'll be working for you. I'm going to stop talking now because I'm going to just focus on some deep breaths. But thank you all so much. I'm going to miss you. It's been incredible for almost 4 years. I know, I'll close by saying, I know Oregon's early learning days our best days are yet to come. And I'm going to be helping from where I am. So thanks.
Thank you, Maryam. I think we all are applauding in our own parts of the country and the state, and just filled with appreciation, and also filled with, I think, wonder and admiration for the career that you have had and that you obviously are continuing to launch and to expand. This country is so blessed to have you in a leadership role. And I knew the day Biden got elected that we would be having this conversation. There was no doubt in my mind. When I voted for him, I thought, oh, well. Better stop being quite so myopic about this. So anyway, thank you from the bottom of all of our hearts. And we wish you, Sam, and the twins the very best as you transition out.
Thank you.
And the dogs too.
Good point, Peter. And the dogs who go everywhere with this family.
Yes.
Okay, Council, thank you all for being with us today. David, Harriet, Carrie, Remy, thank you for the hours and hours of planning that have gone into this 4 hours. Really a very productive and informative meeting. So thanks everybody, and have a good evening. Bye-bye.
Thank you.
Thank you, Sue. Bye.
Bye,
Bye-bye.
Miriam.
Bye, Miriam.